Good afternoon po, ma'am.
Good afternoon, Sir Ron.
Nag-echo po yung sounds po ninyo.
Wait lang. Sino po ba?
Kayo po, ma'am.
Nag-echo pa din po ba ngayon?
Okay na po, ma'am.
Okay na, okay. Good evening sa ating lahat. Nandito na po ba? We have 9 minutes before we start. Hi. 9 minutes before we start. Nakikita po ba ang screen? Clear po ba ang audio? Ang responsive naman ng mga tao dito. Sana maging masaya ang rush na to. Dahil po, walang mga frozen meat yung mga previous sections na nahawakan ko. Ang mga tao po dito ay masigla. Ganun. Okay guys, before tayo mag-start, mag-introduce ako ng sarili ko sa inyo ngayon before 6 p.m. Para as exactly 6 p.m. we would be starting number 1 talaga. Para hindi ma-consume yung time natin for the rush show. So we have 2 hours for tonight. I will be rationalizing from 6 p.m. to 8 p.m. And sana makatapos tayo ng kahit at least 75 items lang. I think 75 items will do. Kasi mahaba ang MS. Kasi we're doing a little bit of fatty para mas maganda yung ratio. Ma'am, hanggang 10 p.m. po kayo. What?
Yes po, ma'am.
Yung SCAD ko po, sir, is 6 to 8, 8 to 10 na parang magkaibang section. Akala ko dalawa yung section ko ngayon. Hindi ba? Hanggang 10 p.m. po kami.
Yes po, ma'am. Tas bukas po yung hanggang 8 p.m. po.
Okay. So 2 hours po kami bukas, the same section po.
Apo, apo.
Okay. Baka parang ano lang, miscommunication na sa binigay sa aking sked. But anyway, alam mo na 6 to 10 p.m. ako, pero akala ko ma'am, medyo mahina po yung alin po, yung audio ko. Ay, wait, siya. Ngayon po, is it okay? Is it better now? Is it better now? Okay. Last 5 minutes, I will be introducing myself. My name is Lorelie Pumentil. I am from Eastern Samar. I graduated in Samar State University, and I took the boards last year, November 2022. Passed and nag-rank 4. Yay! Thank you to Top Rank. Hello, Mama. Okay na gabi. Uy, from people from Tacloban, mga waray nun. Ay, intentionally ako pumasok ng maaga kasi nung last ko is hindi ako napakilala kasi ayoko nakukonsume yung time ng rasyo. So, exacto akong pumasok ng 6. Agad kami nagsimula. Walang intro-intro. Kasi ayoko makonsume ng time yung rasyo. And nung first rasyo namin, nung first 4 hours, nakatapos na ako na 110 items, guys. And then pagka next day, we only had 2 hours and I have to rush 140 items. Hindi naman dahil sa mabagal, kundi we were trying to rationalize as much as possible in a way na maintindihan po ng lahat. Pero it was a little bit of disadvantage kasi masyado kong binilisan pagka next day kasi we only had 2 hours and it was 140 items pa. So what we are going to do right now is susubukan ko pa ding mag-ratio in a way na mararasyo lahat kahit yung mga maling options. But we will be more focusing on the ratio ng mga tamang sagot para hindi masyadong malaki yung makain na time at hindi tayo magmadali bukas katulad nung nangyari sa aking mga previous ratio. At exactly 6 p.m. tayo po ay magsisimula. Ano po bang mga sections ito? Pure online po ito, no? Pure online po ba lahat ang nandito?
Combine po siya, ma'am. Pure online tsaka face-to-face po.
Okay. May on-site din po pala. Hanggang 10 pala tayo, parang hindi ako ready sa part na yun. Akala ko hanggang 8 lang. But that's fine, that's even better. I think it's okay na magsimula na, no? Wala na naman tayong pinag-uusapan. Okay na, nakapagkilala na ako and alam ko na yung mga sections na nandito. Is it okay to start? Kahit 5:58 pa lang? Yes po, okay. This is your Recus 9 Rasho, NP3 second half, all throughout NP4 and NP5. Let us start with number 51. Situation. Mrs. Olivar is 38 years old, 3 months pregnant with their 4th child. She was brought by her husband to the ER. Ang approach ng question is OB, pero ang mga tanungan po dito is MS, focusing on perioperative. By her husband to the ER, and she reported that she had an episode of heavy vaginal bleeding. She felt something fell from her abdomen and that it now feels to be blocking her vaginal opening. NP3 number 51. NP3 number 51. She continuously has a blood spotting from her vagina. Number 51 question, the OB gynecologist inspected the patient's perineum and saw that may abortus po, almost expelled from the vagina, and it was a case of a spontaneous abortion. The physician explained to Mrs. Olivar that she needs to undergo a procedure to completely remove the abortus and clean the uterus. Ang tanong, anong procedure po ang in-expect ng nurse na gagawin para ma-clean ang uterus at matanggal ang abortus? What's the answer, guys? Okay. Sagot lahat. Okay, answer is letter A, dilatation and curettage. Ang DNC po is where we do a lower part of the uterus is dilated and meron po tayong instrument na tinatawag na curette. At ang curette po ay ipinapasok sa loob ng uterus through the vaginal opening wherein kinakayod yung loob ng uterus para matanggal yung mga abnormal tissues, the abortus at yung iba pang product ng conceptus to prevent further bleeding. BTL is a process of permanent fertilization. CS is for giving birth, and episiotomy is the cutting of the perineum during a normal delivery. Number 51 is letter A. 52. For the procedure of DNC, so alam mo na yung sagot ng number 1 kasi yung sumunod na question is about DNC, no? What position will the nurse put the patient to provide the physician a good vision and allow movement during the procedure? So ang tinatanong sa iyo dito is a matter of positioning. Ito po ay concept ng funda. Pag ang tinatanong po sa iyo ay positioning, ang tatandaan mo po ditong general concept is the purpose of your positioning is to expose your operative site. Expose the operative site. So if you have your knowledge in anatomy, at alam mo kung saan i-perform ang procedure, all you have to think of is wait lang. Okay na ba? Sorry about that.
Yes po.
Okay na. All you have to think of is anong position ba ang mag-i-expose ng operative site. So ang sinabi ko kanina, your DNC is done through the pagpasok ng curette sa vaginal opening. So ang position mo na mag-i-expose ng operative site, which is the vagina, is yearly taught to me. Ang Kraski is your knee chest, so no. Since laterals also no. Semifollowers also no. So lithotomy will expose the operative site, which is the vaginal opening, 52B. Masyado po bang mabilis or okay lang? Masyado po bang mabilis or okay lang? Ang bilis po. Okay lang po. Okay lang. Mabilis po. Medyo mabilis. Okay, dadahanan. Lag ako. Lag ba ako? Wait. Okay, dadahanan po natin ng kaunti. Ha? Pakonti-konti po. Number 53 tayo, no? Okay, it's para hindi kayo nagra-rap. Nasanay ako sa mga previous ratio kasi kailangan bilisan. Okay, sige. Dadahanan ko ng kaunti. Number 53, positioning. Ang tanong ulit ay positioning. Ang tanong, positioning is important in client safety during, hindi ba nakikita ang screen?
Yes ma'am, tinigil ko yung screen share po nila.
Nawala po yung screen share?
Yes po, opo.
Oh my gosh. Yan.
Okay na po.
Nakikita na po ba yung question number 53? Nakikita na po ba ang question number 53?
Yes po ma'am, sharing na po kayo ng screen.
Okay, let's go. Ang number 53 po ang tanong is positioning. Positioning is important to client safety. Ang tanong, kailan po piniperform ang positioning? Positioning is done. So ang anesthesia po natin is mayroong 4 phases. Pag nag-anesthesia po tayo, mayroon yang tinatawag na 4 phases. Yung beginning, excitement, surgical, and medullary. Yun po yung 4 stages ng iyong general anesthesia. Beginning, excitement, surgical, and medullary. During po dun sa ating tinatawag na excitement phase ng iyong general anesthesia, ang pasyente po doon ay nagiging hysterical. Sila po ay nagsha-shout, nagtutok, tumatawa, kumakanta, umiiyak, malikot po sila. So we do positioning after anesthesia induction. So i-eliminate na po natin yung mga before anesthesia induction. Dahil po kahit mag-positioning ka sa patient, tapos mag-deliver ka ng general anesthesia and the patient undergoes the excitement stage of general anesthesia, magiging malikot pa rin po yung pasyente. So we do position the patient after anesthesia induction. So the question is before surgical draping or after surgical draping? Before surgical draping po ang sagot. We position the patient properly and appropriately according to the procedure na gagawin, and then we surgically drape. Hindi po tayo magpo-position after surgical draping dahil masisira po yung draping na gagawin sa patient. So 53 is letter C. Okay po ba yung ganong speed? Number 54. Okay na yung ganung speed. Number 54, Mrs. Olivar was deeply affected by the unexpected loss of her baby, and she it might again the future. So she requested the physician for bilateral tubal ligation. Ligation, BTL. Ang tanong, what instrument should be used to grasp the fallopian tube? Ang iyo pong mixture ay used to clamp blood vessels. Ang iyo pong alis ay nag-grasp ng heavy tissues. Katulad ng fascia. Alam niyo yung fascia? Yung fascia, yung tissues na nakasurround sa iyong muscle, heavy tissues po yun. Ang yung coker ay ginagamit din to clamp large vessels din po ito. Large blood vessels. Ang sagot po ay babcock. Ang iyong babcock po, ito po yung ginagamit mag-grasp ng mga delicate tissues katulad ng iyong fallopian tube and ovaries and intestine. Ito po ay para sa mga delicate tissues. Number 54 is letter D. Number 55, post-op, Mrs. Olivar was sent to the recovery room. In the first hour after surgery, and patient's vital signs are assessed every. Gaano kadalas natin ina-assess ang vital signs ng patient's post-op? 15 minutes po. We do assess the patient's vital signs 1 hour post-op every 15 minutes. Number 56, situation. All surgical procedures can potentially affect a person's functional abilities. Ang impact po ay great and permanent. It can either be great, brief, or temporary. Therefore, client care during pair of phase demands knowledge and skill in pair of care and also requires in-depth understanding of related disease process that have brought the client to seek treatment. Pero pa din po tayo. Number 56. Nurse Jessie is an OR nurse caring for patient Ben who is for cholecystectomy. Cholecystectomy is what? The removal of your gallbladder. Patient Ben is being prepared for pre-op medication, administration, and all of the following are nursing considerations to ensure patient safety ang pinag-uusapan except. Place the call bell next to the client is yes. Dahil po for every time the client needs the nurse, madali po niyang matawag ng nurse. Side rails up is also a yes. Ang hinahanap po natin is negative. Instruct client not to get out of bed. Bakit po? Ang pre-op medications such as your pre-op medications, babcock yan, di ba? Bakit sinabi mo siya? Ito po. D, babcock. Si ba ang sinabi ko? Instruct client not to get out of bed dahil may risk for fall po ang patient. May risk po ang patient when given pre-operative medications because pre-op meds cause drowsiness and sedation sa ating patient. Ang hindi po kasali dito, exception is letter D. Teach deep breathing exercises. Ang teach deep breathing exercises nakafocus po sa re-expansion ng lungs post-op. Hindi po siya nakafocus sa patient safety. Letter D for number 56. Number 57, while performing preoperative history and physical assessment, patient Jessie does admit smoking a pack of cigarettes daily. Nag-smoke ang iyong pasyente. What education regarding smoking should the nurse provide to the patient prior to scheduling the patient for surgical procedures? A, i-reduce mo ba ang usual number ng smoke cigarettes to 50% lang? Hindi po. Tumawad ini good to your patient. Use incentive spirometry. Post-op will not help the patient as well. Ang pinag-uusapan po natin dito is prior to scheduling. Smoking cessation started after surgery is wrong. Ano pa po ang gamit ng cessation kung tapos na ang surgery? The correct answer is letter B. Stop smoking 4 to 8 weeks before. So that's 1 to 2 months before ang scheduling ng surgery to prevent complications. Number 57 is B. Number 58. The patient asks the nurse why food is withheld. Bakit ba po tayo nag-NPO before surgery? What is the best response by the nurse? Presence of food in GA tract may cause obstruction in surgical abdomen. Hindi po yan magkakos ng obstruction. Infection, if fluid or fluid is taken prior to surgery, hindi naman dahil kumain magkakaroon ng infection. Distension is not even a severe complication. So hindi din po letter B. Ang sagot po is letter A. Aspiration is a concern and can be complication if food and fluid is taken close to surgery time. Bakit po? During surgery at nagbibigay tayo ng anesthesia, especially if it's general anesthesia, nagkakaroon po ng cessation ang gastric motility. So hindi po nawawala po yung gastric motility. So tendency is pwede pong mag-reflux or mag-regurgitate ang food contents ng stomach at mapunta sa lungs, and that is risk for aspiration, which is very dangerous for the patient. NPO prior to surgery is an aspiration precaution. 58A. Number 59. The physician ordered RSI. Ano po ba yung RSI? Familiar po ba tayo sa RSI? Masyado po mabilis po. Mabilis pa din ba? Mabilis pa din po ba tayo? Sakto lang naman, sakto lang po. Sakto lang po, okay. Kasi pag masyado pong mabagal, MS po ito guys ha. Hindi po tayo pwedeng super mabagal sa MS. Kasi po magpa-photopy tayo sa ilang items. Hindi po tayo matatapos. Sakto lang ma'am. Okay, sige po. Thank you po. Ang RSI po ay isang method of steps. Method of steps na ginagawa ng OR team pag ang RSI po, rapid sequence induction, ay method of steps na ginagawa ng OR team pag ang pasyente ay may risk for aspiration. May risk of aspiration. So ginagawa po ng steps na ito pag hindi sigurado yung OR team kung maa-aspirate ba ang pasyente o hindi. The physician ordered RSI before the surgical procedure was started. Nurse Jessie understands that the possible indication in performing RSI intraoperatively are the following, except. So alam mo na yung purpose ng RSI para maiwasan ang risk of aspiration. So ano ang indications para gawin ng RSI? Letter A, the patient may have been inadequately starved. Hindi sakto yung oras ng kanyang pag-NPO. For example, kailangan mong 8 hours, pero nag-NPO lang siya ng 4 hours kasi emergency na yung gagawin na surgery or procedure. So, inadequately starved is a yes. Mag-RSI ka dyan. It is an emergency procedure where the patient was brought and monitored. Pwede to, yes. For example, ang patient isinugod sa ospital, sa gasaan, hindi mo alam kung saan galing, sa piyesta ba, sa birthday, sa lamay, hindi mo alam kung kailan ang last nakain. Pero emergency, kailangan operahan. A risk for aspiration ba? Yes po. So kasama ang letter B. Letter D, C or D, the patient has a history of gastric reflux. Yes po, may mga pasyente po tayo na kahit gano'n natin i-NPO dahil may gastric reflux sila, nag-reflux pa rin ang gastric contents, so risk of aspiration pa din. Nang hindi po kasali is letter C, larger amounts of anesthesia is needed due to high level of alcohol in a patient's blood. Actually, totoo po ito, na pag may mataas na level ng alcohol sa dugo ng pasyente, we need larger amount of anesthesia. But this has nothing to do with aspiration precaution, and hindi po siya indication ng iyong RSI. Number 59, C. 60. Okay, naglalag. Wait lang guys. I think it's my hand kasi ang basa-basa ng kamay ko. Okay. Number 60, the surgical safety checklist. Ang surgical safety checklist po ay madalas nang tinatanong sa board exam ngayon. Inaral po ba ang surgical safety checklist? Pag ang itanong sa iyo is ano ang purpose or uppermost goal ng surgical safety checklist, ito lang po ang sagot. Ensuring patient safety. Ensuring patient safety. At ito po ay divided into 3 phases. Ang iyong surgical safety checklist, ang purpose is ensuring patient safety at ito po ay may 3 phases. Ang tanong, what phase represents the final recapitulation and reassurance ng accurate patient identity, ng surgical site, at ng plan procedure? Ito po ay mayroong active involvement ng lahat ng surgical team. Meron po silang oral and verbal agreement na tama po ang lahat na nasa OR. Ano pong phase ito ng surgical safety checklist? Ang sabi dito, 3 lang. So, wala tayong time-in, guys. Wala pong time-in. Ang sign-in po is ginagawa before induction. Ang nurse ay nagtatanong sa patient ng information, ng consent. Also, nandito po yung surgical site marking. While your sign-out is ginagawa before patient leaves OR. So, ang tamang sagot po is letter D. Ito po yung usually nakikita nyo sa mga K-drama wherein nag-i-state po sila ng kanilang mga role, ng name, ng OR team, and they confirm to each other verbally yung kanilang name ng pasyente at ng name ng procedure. Tapos, they're like nagnanod to each other. Ang tawag po natin doon during the surgical safety checklist is your timeout, number 60. Number 61 situation, Kim is a 45-year-old mother of 4. After a needle aspiration biopsy is diagnosed of having malignant breast tumor. Nag-biopsy, may malignant breast tumor, stage 3 na po ang pasyente. She was scheduled for a modified radical mastectomy or MRM. Question, on assessment, her breast tissue had a dimpling orange peel. Appearance, Nurse Jillian recognized this clinical manifestation as ano? Hindi po yan inverted nipple. Ang inverted nipple po yung nangyayari na pumapasok yung nipple sa alveola. Ang lymphedema naman po is hindi din. Ito po yung edema ng mga lymph nodes. A or B? Ang sagot po as A. Ang tawag natin doon is potherange. Ano po yung B? Ano po yung Zilon nipple? Wala pong ganon. Gawa-gawa lang yan. Ang sagot po is letter A. Wala po yung letter B. Number 62. Patient Kim was admitted to the hospital for further evaluation. Admit na siya for monitoring prior to surgery. Ano ang position of to promote comfort should the nurse put the patient? Question is positioning. Side lying po ba? No, kasi hindi po in-specify kung both breast ba affected or isa lang. So hindi ko pwedeng mag-side lying dyan dahil po kung naka-side lying affected ang right breast, masakit po yan sa patient. So fine would not help the patients is either B and C. P or C. Hindi po tayo mag-B dahil po pag ang pasyente is naka high fallers position, suspended po yung boobs. Mayroon pong pressure sa tumor. Yung breast tissue po is magpuput ng pressure doon sa tumor and it will cause pain to the patient. Ang position of comfort po for the patient is semi-fowlers dahil suspended po yung boobs papunta sa chest. So wala pong pressure na mapuput doon sa iyong tumor and this will bring comfort to your patient. So your answer for number 62 is semi-fowlers letter C. 63, patient Kim's breast cancer is in stage 3. Nurse Jillian understand that this means cancer cells limited in the local area, ito po ay stage 1. Cancer cells limited to regionally, ito po ay stage 2. Kapag nag-metastasize na po papunta sa ibang parts ng body, ito po ay stage 4 na. Ang inyong pong stage 3 pag-extend ng local and regional area, letter B for number 63. Number 64. Ang patient mo, the patient was anxious about the surgery and stated that she wasn't able to understand most of the things na sinabi ng surgeon. So nag-explain na po yung surgeon, hindi niya daw po naintindihan and she was very anxious about it. She wanted to ask the nurse regarding sa clarifications in modified radical mastectomy. Tanong, ano ang dapat gawin ni Nurse Jillian? Letter A, explain that MRM involves the removal of lump, entire breast, and axillary lymph nodes. Yes po, tama po ito. Ito po ang MRM. Modified radical mastectomy is the removal of the lump, the entire breast, tissue, and axillary lymph nodes. Ang letter B po, only the removal of the lump is lumpectomy. Hindi po ito tama. Lumpectomy lang po ito. Explain that this is a course of external beam radiation therapy. Hindi po, radiation lang po ito. Or letter D, call the surgeon and serve as the patient's advocate requesting to re-explain the procedure. Ano po ang sagot? Ano po ang sagot? Letter D ang tamang sagot. When a patient does not understand the explanation of the procedure, it is not the nurse's legal responsibility to re-explain. All you have to do is to serve as the patient's advocate, call the surgeon and request for re-explanation because it is the surgeon's legal responsibility to re-explain. Your job is to only make sure na maintindihan ng pasyente. Kung hindi niya maintindihan, call the surgeon. Answer is number 64, letter D. Oh, gosh. Talaga siya. 65, teaching patient self-care is an important nursing responsibility for continuing care post-op and even after discharge. So, tapos na ang iyong surgery at nagbibigay ka na ng mga post-op teaching and self-care. Teaching and reinforcing regarding BSE is a vital part. Education has been effective if when the patient is stated effective positive. I must examine my breast during shower at least once a week. Tama po ba yung during shower? Yes po. At least once a week po ba? Mali po. Once a month lang po tayo. Ito po ay example ng double barrel option wherein tama po yung first part pero mali yung second part. You should be conscious ng mga ganong options. Letter B, I will coincide my BSE during my menstruation as it increases likelihood of detecting alarm. Hindi po. Ang atin pong BSE is ginagawa a week after. A week post-mens. Hindi po during. I will palpate my breast using 2 to 3 fingers, circular motion from center to periphery. Tama po ito. Present lumps are commonly palpated in the outer lower part. Mali po ang outer lower part. Saan po natin commonly napapalpate ang lumps? Saan? Upper, tama. Upper saan? Upper saan? Upper outer. Ito ganito po ang pag-draw. If for example, ito po yung bulbs. This is your upper outer. Upper siya kasi nandito siya sa taas. Outer siya kasi nandito siya sa labas. This is your upper inner, lower inner, lower outer. Ganito din po dito. This is your upper outer. This is your lower outer. Ganun po yung pag-divide natin sa quarter ng bulbs. So ang lumps po is commonly present dito po sa area na ito. Sa upper outer po. Upper outer. So mali po ang letter D. Ang correct answer lang po is letter C. You palpate your breast using 2 to 3 fingers circular motion mula sa nipple palabas from center to periphery. Number 65, letter C. Number 66. Mr. Ronaldo is a 58-year-old accountant who has been a one pack a day smoker for 30 years. He has had persistent cough for 1 year that is hacking and non-productive and has had repeated unresolved upper respiratory tract infection. Diagnostic evaluate to the diagnosis of localized tumor pero walang evidence ng metastatic spread. May tumor pero wala pang metastasis. Mr. Ronaldo was subjected for radiation and therapy. Ang coverage po ng next 5 question is radiation and therapy. Number 66, the patient is being treated with internal radiation. Ano? What is the nurse's priority action when caring for this patient? Nandito po ang ating ratio. So, ang atin pong code is BITE. Brachytherapy is also your internal. Your teletherapy is also your external. Pag internal po ang radiation, ang patient is said to be radioactive. Pero pag external lang po ang radiation, the patient is said to be not reactive. An internal therapy or brachytherapy, mayroon po tayong dalawa, yung sealed at yung unsealed. Pag sinabi po natin sealed, ito po ay implant. It's either in the vagina or in the rectum. Ang focus po ng ating nursing management is risk of dislodgement noong implant. Pag unsealed naman po, ang radioactive po is yung secretion ng pasyente. Ihi, tae, yung mga secretion po, ito po ay via IV or oral. Pag external naman po ang iyong radiation, not reactive ang pasyente, ang focus ng iyong nursing management is skin integrity dahil po ang pasyente is at risk for radioactive burns. So ang pasyente po natin sa previous question is naka-internal radiation therapy, which means the patient is radioactive. Radioactive. So, priority active bed lines, ating save bed linens, ito po yung sineseparate natin yung linens niya. Hindi po natin nanahalo sa bed linens doon ng ibang pasyente dahil po radioactive siya. Log. Wait sa. Anong klaseng lag? Yung voice po or yung screen? Yung voice po or yung screen? Voice, both. Ikaw po, voice nyo po. Both, ma'am. Ilalag out ko yung isa kong device. So, wala na. As of now, may video ako, di ba? So, ang mangyayari, guys, ilalag out ko yung isa kong device and wala na muna akong video. Is that okay? It might help. Okay. Ilalag out ko yung isang device. Okay. Pangin kasi gano'n kay gamit device na nakapangan.
Recording in progress.
Okay. Tingnan natin ngayon, guys. Okay, nag-adjust na po ako. Wala na akong video, di ba? Wala na akong video, di ba? Opo. Nilag out ko po yung isang device and then nakalagin na lang po ako sa aking tablet na naka-share screen na hindi ko na din po i-open ang camera. For the sake na hindi na tayo mag-lag, I hope it's better. Naglalag pa din po ba ang aking voice as of now?
Okay na po siya ngayon.
Okay na po, okay. I hope it's better. Kasi yung mga previous ratio ko, okay naman. Okay. Hindi naman po ako nagka-problema sa internet. Okay, hindi na po. Okay, let's continue. Nandito tayo sa letter D. Sabi ko, maganda ang safe bed linens. Dahil po, hindi natin dapat ihalo yung bed linens ng pasyente sa ibang pasyente dahil radioactive po ang ating naka-internal radiation therapy. And maintain as much distance as possible is wrong. We only do 6 feet away. Hindi po specific yung option. Alert family members that they should restrict visiting 10 minutes. Mali po yung 10 minutes, dapat po 5 minutes lang. Ang nurse po na naka-duty sa pasyente na nag-aalaga ng naka-radiation, has only 30 minutes per shift. Alam po ba natin to? 30 minutes per shift lang. So sa buong shift niya, 30 minutes lang dapat ang interaction niya sa pasyente, and that 30 minutes is divided into 6 visits with 5 minutes each. Kasi ang maximum exposure po natin dapat sa pasyente na naka-internal radiation therapy is 5 minutes lang. So for 30 minutes, 5 minutes, so 6 visits lang. Hindi po tayo nagte-10 minutes, lalo na kung visitors lang naman. Ang priority po natin dito is to wear a lead apron. Bakit po? Ang prioritize natin dito is ang safety ng nurse. Naka-internal radiation therapy ang pasyente, radioactive priority, safety nino ng nurse po. Dahil ang harmful po sa situation na ito ay ang pasyente. Number 66 is A. 67. Mr. Ronaldo is taking 5 FU for his chemotherapy. What system should the nurse be sure to assess for symptoms of toxicity? Familiar na po ba kayo sa drawing na ito? Familiar na po ba kayo sa drawing na ito? Nakita niyo na po ba ito kay Sir Lian? Hindi pa po. Okay. Ito po yung ginamit namin para madaling ma-memorize. Nakadikit po ito sa aking dingding. Pag sinabi po nating 5 FU, ito po siya, 5. Nandito siya nakalagay dahil po ang toxicity ng iyong 5FU is nasa gastrointestinal system. So, nagsisimula po sa mouth, papunta sa esophagus, papunta sa stomach. And ito po siya, yung 5FU, gastric toxicity, kung saan ang pasyente ay nakaka-feel ng left gastric pain. Kaya po, ang focus ng assessment ng nurse pag ang pasyente nagtitake ng 5SU is nasa gastrointestinal system. Nakikita niyo po yung V dito. Ito po yung vincristine dahil meron po siyang peripheral neuropathy. C dito is for cisplatin, nephrotoxicity. So, i-screenshot nyo na lang po. Pero ituturo pa po ito sa inyo, I think sa final coaching na part ni Sir Lian. I-screenshot na lang yung part ng drawing para madali nyo na din makopya. So for number 67, the focus of assessment is gastrointestinal system dahil ang iyong pong 5SU na chemotherapeutic agent is nagkakos ng toxicity sa iyong GI tract. 68. The nurse assessed the extravasation of chemotherapeutic agent has occurred. Ano ang initial action ng nurse? Thank you kay Ma'am Angela. Then ano ang extravasation? Ano po ba ang extravasation? Pag sinabi nating mag-iba po ang tinatawag nating infiltration and extravasation. Infiltration and extravasation. Parehas po sila kung saan ang agent na dinideliver sa vein ng pasyente intravenously is nagkalat palabas, lumabas sa vein, napunta sa surrounding tissue. The only difference between infiltration and extravasation is pag ang infiltration po, hindi po to physical drug. Ito po yung parang mga IV fluid lang, and then hindi naman po siya ganun ka-harmful sa surrounding tissues pag nag-infiltrate. But when we talk about extravasation, ito po yung mga vesicant agent, katulad po ng chemotherapeutic agent, malakas po sila na pag naglumabas po sa vein at napunta sa ating surrounding tissue, ito po ay nagkukos ng damage sa surrounding tissue. Yun po yung extravasation. So kung ganun po ang nangyari, ano po ang initial action ng nurse? Hindi po makakatulong ang warm compress. Place site over the site infiltration is low. In fact, an antidote, hindi ka naman po magbibigay agad ng antidote. Ang una mo pong gagawin, initial action is discontinue to prevent further harm or damage sa surrounding tissues ng extravasation. 68 is B. 69. Yeah. What does the nurse understand as the rationale for administering allopurinol for a patient receiving chemotherapy? Madali pong tandaan lang allopurinol kung ano po ang kanyang gamit. Ang sinasabi po natin dito pag allopurinol, alang purine. Pag allopurinol, alang purine. Bakit po? Bakit po natin kailangan ng allopurinol pag ang pasyente is nag-undergoing chemotherapy? Ang nangyayari po sa pasyente nagki-chemotherapy is nadi-destroy po yung kanyang tumor lysis. Meron po tayong tinatawag na tumor lysis. Pag sinabi po nating tumor lysis, ito po yung dinidestroy niya po yung tumor. At pag na-destroy po yung tumor, ang end product po ng tumor is potassium and uric acid. Ang tumor lysis po may end product na potassium and uric acid. So ang pasyente po nagkakaroon ng hyperkalemia, and hyperuricemia. Dahil po sa end product na potassium and UA pag mayroong tumor lysis during chemotherapy. So ang nangyayari po, nagbibigay po tayo ng allopurinol dahil po ang end product ng iyong purine ay uric acid. So we give allopurinol alang purine to counteract the hyperuricemia na dinudulot ng chemotherapeutic agents. So ang sagot po sa number 69 is letter D, it lowers serum and uric acid levels. Hindi po yan nag-prepare ng alopecia, hindi po siya, it has nothing to do with anemia, and lalo nang it has nothing to do with immune system. Your answer for number 69 is letter D. Naiintindihan po ba? Nakakahabol po ba? Are we good? Yes po. Yes, okay. Number 70. What intervention should the nurse provide to reduce the incidence of renal damage when a patient taking chemotherapeutic agent? So iniiwasan natin ang renal damage during chemotherapeutic agent dahil madami pong iniinom ang pasyente. Limit fluid intake 1,000, 1 liter lang po ito, napakaliit. Withhold medication when BUN level exceeds 20 mg per DL. Ang upper limit po natin ng BUN is 20 talaga. Ang normal level po nito is 7 to 20 mg per DL. So pag nag-exceed na ba sa 20, will we withhold? Hindi po. Mag-refer ka lang po sa doktor. Hindi mo basta-bastang i-withhold ang chemotherapeutic agent because that will be risky for the patient. Take measures to acidify the urine and prevent uric acid association. Wala kang magagawa dito. Ang iyong magagawa as a nurse is to encourage increase in oral fluid intake to prevent renal damage para ma-promote ang excretion ng end product ng iyong chemotherapeutic agent. 70A. 71 situation. Master is a 70-year-old male who was received on the nursing unit from the PACU. Nag-underwent siya ng hemicolectomy for colon cancer 3 days ago. The nurse assessed and got the following vital signs. May fever po, tachycardic ang pasyente, tachypneic, pero ang kanyang systolic BP po ay normal. Ang kanyang BP po ay normal. May fever, tachycardic, tachypneic, pero normal po ang BP. He was shaking with chills. Ang extremities are cold to touch. Cold and clammy po ang pasyente. And the nurse suspected septicemia. And he immediately notified the healthcare provider. So nagsuspect po tayo ng septicemia. Tanong, number 71. The patient asked what could have led to the development of this infection. Sabi niya, bakit ako nagka-septicemia? The nurse know that there has been a mistake during the surgery. Hindi po. The cause is unknown. The cause is known. Septicemia is inevitable or gram-negative bacteria. Ang septicemia po is hindi inevitable. Pag sinabing inevitable, unavoidable. Avoidable po yan, kaya po tayo ay gumagamit ng mga septic technique. Ang sagot po is letter B. Ang gram-negative bacteria are the most common pathogen causing septicemia. Kaya po kahit ganong aseptic technique natin sa OR, nagkakaroon pa rin po ng mga septicemia and infections post-op. Number 71B. 72. When the nurse assesses and determines that the BP is within the normal limits, nasa normal pa daw po ang BP, she recognizes that the patient is in what stage of shock? Meron po tayong different stages of shock. Ang iyong B and C, magparehas lang po sila. Ang iyong decompensated and progressive stage is magparehas lang po sila. So automatically mali na. Irreversible is the stage kung saan hindi na natin kayang ma-reverse yung pasyente. Sobra na ang nangyaring sobrang bagsak na ang BP. Hindi kahit anong fluid reso natin, hindi na natin maibalik yung normal BP ng pasyente. So kung nasa within normal limit pa yan, ang pasyente po ay nasa initial stage ng shock. Ang nangyayari po during initial stage of shock is meron na po talaga ang hypoperfusion, but because of the compensatory mechanisms done by your body, lalong-lalo na ng heart, kung saan nagtatakicardic, katulad ng nakita natin kanina na mataas ang HR ng pasyente, lumalakas po ang beating at mabilis po ang beating ng heart. So kahit po hyperperfusion na, we are able to maintain the BP at the normal pressure. Pero habang tumatagal, hindi naman po nakakatiis ang heart ng napakatagal na pagtakicardia. As the shock progresses, bumababa na po ang BP. So kung within normal limits, nasa initial pa po tayo. Number 73. The nurse prepares the plan of care to ensure early intervention along the continuum of shock to improve the patient's prognosis. All of the following are included in a plan of care except negative ang hinahanap natin. To prevent, improve the patient's prognosis. Assess the patient who has a risk for shock. Tama po. Dapat close monitoring tayo sa patient na at risk for shock. Monitor changes in vital signs. Tama po. Administer IV fluid as prescribed. This is fluid reso. Ang hindi po kasama is prophylactic packed RBC. Hindi po natin ginagawa to. Hindi po tayo nag-prophylactic packed RBC, lalo na po kung wala namang doctor's order. Number 73, exception, letter B. #74. Fluid reso is immediately instituted as a medical management in shock. All but one are IV fluids used as replacement during shock. All but one. So ang hinahanap po natin, negative. Ang ginagamit po natin sa fluid reso is isotonic. Isotonic. Isotonic ba? Yung 0.9 NaCl, ito po ay PNSS. Yes po. LR ay isa din pong isotonic fluid. Between your D5W and your D5 water, asan po ang pinaka hindi pwede? Pinaka hindi pwede. Ang iyong pong D5 water is isotonic in the bag, pero hypotonic na po siya in the body. Bakit po? Ito po, pag pinasok mo na ang D5W sa katawan, nakukonsume na po yung dextrose, yung glucose, and water na lang po yung natitira, and water is hypotonic. Ang D5LR naman po is hypertonic. Ito po yung mas mali na hindi na po natin dapat ibigay. Dahil pag hypertonic po ang fluid, magkukos po ito ng further cell dehydration. Dahil po maa-attract niya yung water from the cell ma-attract niya po ang water from the cell palabas. Magkukos po ito ng further cell dehydration dahil mas mataas po ang kanyang concentration kaysa sa normal body fluid. Number 74, D5LR ang ating exception, letter D. 75. What position is best for the patient during the episode of shock? Positioning ang tanong. During shock, anong tawag natin sa position na to na nakikita nyo? Anong tawag dyan? Letter C, modified Trendelenburg. Bakit po tayo nagbo-modified trendy? Pag shock po ang pasyente, nakasupine po yung dyan at naka-stay po dito yung ulo sa level ng trunk pero nakataas po yung paa. This is to promote adequate fluid venous return. This position prevents cerebral venous congestion. So hindi po na, kasi pag ganyan po talaga yan na Trendelenburg, magkakaroon po ng cerebral venous congestion. Pero ang ginagawa po natin sa modified is na parang nakasupine po siya at yung ulo po is naka-level lang ng trunk to prevent cerebral venous congestion. Yung pagtaas naman po ng paa is it increases venous return to the heart at nakaka-focus po yung blood sa central body kung nasaan ang mga vital organs. Nandito yung heart, yung kidneys, yung liver, dyan po na atin focus ang ganitong positioning. So if your number 75 is letter C, modified trendy. 76. Sheer is 38 years old. It's scheduled for colonoscopy as a diagnostic exam for suspected colon cancer. To achieve a better visualization of the colon, the physician ordered to evacuate the colon enema. So evacuate the colon through administration of enema. Number 76 question, for the purpose of evacuating the colon prior to colonoscopy, Nurse Lena know that she will administer ano? Ang yung pong return flow enema is yung ini-stimulate lang po yung peristalsis. Nag-stimulate lang po tayo ng peristalsis. Nagpapasok ka po ng fluid alternatively in and out of the colon to stimulate peristalsis. Ang retention ini naman po, ito po yung nag-i-introduce ka ng oil or medication and then nare-retain po siya sa loob ng iyong colon, and then after a while, it will soften it will soften and expel the feces. Ang carminative enema naman po, hindi pong tandaan ito, ang sinasabi lang po natin is pututin si carmina dahil po ang purpose ng carminative enema is to expel flatus. For the purpose of evacuating yung colon, dahil po magko-colonoscopy, ang ibibigay po natin dyan is cleansing enema. Dahil po ang kanyang purpose is to remove feces ng mas maganda completely. Number 76, letter A. 77, Nurse Lena intends to clean as much as of the colon as possible. Yun po ang ginagawa sa cleansing enema with use of high cleansing enema. Anong position changes po? Ang i-instruct niya sa patient to achieve complete evacuation of feces. So kung complete evacuation of feces po ang purpose natin, gusto natin linisin ang buong colon. Ito po ang colon mo. Sabihin na natin colon mo to, guys. Yan. This is your ascending colon. This is your transverse colon. This is your descending colon. This is your sigmoid colon. This is your rectum. This is your anal opening. Nakasunod po ba sa ating anatomy ng colon? Okay. So kung ipapasok mo dito ang iyong high cleansing enema, dito ka papasok. So para mapunta siya sa iyong sigmoid colon at sa iyong descending colon, na dito to sa left side ng katawan, so magli-left lateral ka. Pag nakapasok na siya dito, ang purpose mo na pumunta siya sa iyong transverse colon, magdo-dorsal recumbent ka or supine para makapasok siya sa iyong transverse colon. Ang iyong ascending colon ay nasa right side ng abdomen, so para makapasok sa dito, mag-right lateral ka. So yan po ang series ng position changes na gagawin mo para mapasok ang high cleansing enema sa buong colon. Number 77 is letter B. 78. The nurse is about to start the administration of enema. Mag-enema na siya. All of the following are correct steps in administration, except mali po ang hinahanap natin. Lubrication of about 2 inches of the rectal tube using KY jelly. Tama po ang 2 inches. Tama po ang KY jelly dahil ito po ay water-based. Yan po ang ating preferred lubricant sa ating enema. Prime the tubing prior to large volume enema. Yes po, importante po tayo nagpa-prime dahil kung hindi po tayo mag-prime, papasok po ang air sa loob ng colon, magkukos po ito ng distension and pain sa pasyente. Positive, positive. Sir D, ask the client to take a deep breath and insert as the client exhales. Tama po ba as the client exhales? Yes po. As the client exhales, nagre-relax po ang sphincter. Pag nag-exhale ang pasyente, nagre-relax ang sphincter. Tama po ito. Ang mali po is letter C. Tama po yung part na mag-insert tayo is slowly, pero mali po yung towards the urinary bladder. Dapat po towards the umbilicus dahil ang contour po ng iyong rectum is towards the umbilicus. Pag towards po the urinary bladder, hindi mo po mapapasok yung tube. Number 78, it's C. Number 79. While administering the cleansing enema, patient Shear suddenly complained of cramping. Sabi niya, nagka-cramps ako, ma'am, habang nag-administer ka ng enema. Ang tanong, anong dapat mong gawin? What does the nurse Lena do to address the client's concern? A. Do you withdraw the tube and check for stool that maybe block the tube? Hindi po. Ginagawa po natin to during insertion na nakaka-feel ka ng resistance. Pag nag-insert ka, nakaka-feel ka ng resistance, i-withdraw mo po yung tube and chine-check mo po kung may stool na nakaka-block. Letter D, tell the client that it's normal and expected during administration. Hindi po. Hindi po normal and expected ang cramping. Pag naka-feel po ng cramping ang pasyente, may nangyayari pong mali dyan, you have to do something. Immediately stop infusion and report to the MD. Hindi naman po siya ganon kalaking concern to immediately report it to the MD. Ang tamang sagot po is letter C, letter B. Sa enema po, ang nangyayari dyan, if you put the cleansing enema higher, the can higher, ang nangyayari po dyan, mas malakas po ang infusion dyan kasi mas mataas po ang pressure. So to lower the pressure and to lower the flow, ang gagawin mo po dyan is ilo-lower down mo po yung enema. Na-imagine nyo po ba? Mas mababa ang can, mas mababa ang pressure, mas mababa ang flow. So it prevents clamping kasi lesser po ang pressure. And you can also clamp temporarily for 30 seconds. Clamping and lowering the enema both momentarily stops the flow and it both decreases the likelihood of intestinal spasm dahil bumababa po ang pressure. Ang sagot mo sa number 79 is letter B. Number 80. What is the last nursing responsibility in the administration of enema? Instructing the client to retain the enema by lying down. Napakamali po nito. Hindi mo na ba titingnan pagkatapos mong retain ang retention enema? Number letter B, i-assist ang pasyente papunta sa CR para ilabas or i-evaluate. Pwede, no? Pero ang pinaka-last talaga na nursing responsibility is no other than your documentation. Documentation is your legal responsibility. When all else is done, the nursing responsibility had been carried out, document. It is your legal responsibility to document. When not documented, not done. 80D. Number 81. Situation. Mr. Jerusalem was brought, 78-year-old brought by his daughter Camila to the hospital. Sabi ni Camila, ang father niya daw has been experiencing shortness of breath, and it concerns her since her father is no longer able to clearly verbalize physical symptoms, complaints. She added, in the past week, her father had productive, purulent sputum cough. May plema. Ano, number 81? In addition to history taking and physical assessment, the physician ordered for lab test and chest x-ray. Chest x-ray shows presence of pleural effusion. May pleural effusion po yung pasyente na resulted from bacterial infection of the lungs. Nurse Zoe understand that pleural effusion is when air enters the letter A in the pleural space and a lung portion of it collapses. Ito po ay pneumothorax. Pneumothorax. Constriction of bronchial airways is simply bronchoconstriction. Bronchoconstriction. Bleeding around the lungs is hemothorax. Hemothorax. Ang sagot po is letter B. Letter B, pleural effusion is the presence of collection of fluids sa iyong pleural space. Number 81B. Number 82. Severity of the patient's symptoms show large effusion. Sa sobrang severe mga patient na nakita natin, large na po ang pleural effusion. Sabi ng physician, mag-order siya ng chest tube insertion, CTT. Chest tube insertion na nakakonect sa water seal drainage for longer expansion and drain collected fluid. All of the following are appropriate nursing responsibilities for a client in the drainage system except appropriate nursing responsibilities except A. Monitor and maintain the patency and integrity of the drainage system. Gusto natin to maintain patency and integrity. B. Repositioning the client every 2 hours while on drainage system. Tama po ba ito? Yes po, tama po ang letter B. Ito po ay mag-promote ng drainage pag tayo po ay provide comfort. Tama po ang B. Avoid clamping the tubes. Do we avoid clamping the tubes? Yes po, to prevent what we call tension pneumothorax. Tension pneumothorax. We avoid clamping the tube dahil po when we clamp the tube, natatrap po yung air sa thorax and nagkakos po ito ng pneumothorax. Keep the collection fluid at the level of the chest is very wrong dahil po we should put it below the level of the chest to promote drainage and to avoid backflow sa chest cavity by virtue of what? Gravity. Letter D for number 82. Parang gusto ko yung lag, bumagal kayo. Nabibilisan ba kayo ulit ngayon? Pag mabagal kasi ako parang naglalag yung brain ko. Okay, di po ma'am, hindi po perfect. Oy, hindi ako perfect. Charis. Okay lang po. Sakto lang naman, di ba? Hindi masyadong mabilis, hindi masyadong mabagal. Kasi pag mabilis, antukin kayo, guys. Di ba? Pag mabagal, antukin kayo. Trust me. Okay, number 83 na po. Number 83. Number 83, Camila, patient's daughter asked the nurse, bakit po may bubbling? Why are the bubbling in some of the bottles? Nurse Zoe gives the correct information about drainage system by stating that. Sabi niya, bakit daw po may bubbling in some of the bottles? Ano po bang itsura ng iyong water drainage system? Ganito po. Ito po ang iyong water this is, ano ba? Paano po years nito? Hindi ko siya na-erase. Hindi siya water seal. Ito po yung iyong drainage bottle. Ito po yung water seal. Ito po yung suction bottle. Dito po, walang bubbling. No bubbling. Dito po, meron kang intermittent bubbling. Dito po, meron kang continuous gentle bubbling. 8 a.m. to 10 p.m. Okay, so okay lang po. Okay lang yan, guys. So 1 month ka na lang magsasuffer, ha? Lubusin mo na yan. 1 month ka na lang magsasuffer. Okay. No bubbling sa iyong drainage bottle, intermittent bubbling sa iyong sa iyong water seal. Mayroong continuous gentle bubbling sa iyong suction bottle. So dito niya nakikita yung bubbling. So nagtatanong siya, bakit daw may bubbling sa ibang bottle? Ito po ay nakakonect sa pasyente, nakakonect dyan. Ang iyong suction bottle is nakakonect sa iyong suction machine. Na-imagine po ba ang water seal drainage system sa drawing ni ma'am? Na-imagine ba? Anong sagot kung bakit daw po may bubbling? Letter A, I will report this to the physician as this needs further assessment. Hindi po. Letter C, the bubbling in the bottle is spent in the first few hours of digestive therapy but should be gone for a while. Hindi po ito nawawala. Dapat may bubbling po talaga sa ibang bottle. Letter B, there must be no bubbling present in any bottles. Hindi po. May bubbling po dapat sa water seal dahil po humihinga po ang pasyente, dito po nagpupunta yung hangin. Kaya po may intermittent bubbling as the client breath. Meron pong dapat continuous gentle bubbling ang iyong suction bottle dahil po ito sa pressure ng iyong suction machine. So, dapat may bubbling talaga na present. Ang tamang sagot po is letter A. Yun po yung sinasabi ko. Intermittent bubbling occurs in the water seal bottle with respiratory effort and continuous gentle bubbling occurs in the third bottle as this facilitates suctioning. Number 83A. Ma'am pa, SSD, Naisan o next. Thanks po. SSD na, SSD, go! SSD. 1, 2, 3, 1, 2, 3, ganon. Number 84. Okay na ba? Nag-SSD na ba? Number 84. While the client with chest tube is ambulating, the chest tube becomes disconnected from the collecting system. Which action by the nurse is most appropriate? So ganito po, meron po tayong dalawang concept ng dislodge. Pag sinabi po nating disconnection, na-disconnect po ang tube, na-disconnect po ito sa water drainage system. Pag sinabi po nating dislodge na concept, natanggal po yung tube sa pasyente. Nagets po ba? Kasi nakakonect po yung isang tube sa pasyente, yung isa nakakonect sa iyong machine, sa water seal drainage system. It's either na-disconnect siya sa water seal drainage system or na-dislodge siya mula sa pasyente. Ang focus po ng question number 84 is na-disconnect siya sa collecting system. Nakakasunod po ba? Ang tanong sa'yo, which action by the nurse is appropriate pag na-disconnect sa collecting system? Letter A, i-assist mo daw ang client, pabalik sa bed. Priority mo ba to? Hindi. Assess the client's lung sound with a stethoscope. Nag-a-assess ka lang, natanggal yung tube. Hindi po. Immediately clamp or submerge? B or C? B or C? B or C? Immediately clamp, sinabi ko na po sa inyo kanina, hindi po tayo nag-clamp dahil pag mag-clamp po tayo, magkukos po ng tension yung pneumothorax, pag-i-stay po yung air sa thorax, magkukos po ng tension yung pneumothorax. Ang tamang sagot po is letter B. You make a PNSS po ang ginagamit natin dito, wherein we submerge 1 inch of the end of the chest tube sa sterile saline. We are making a temporary water seal drainage. Ito po ang gagawin mo. And pagkatapos, pag nagawa mo na yan, pwede mo na siyang air connect. Pag naayos mo na, ibabalik mo na siya sa water seal drainage system. And then you assist the client back to bed and then you assess. Ganun po yung pagkasunod-sunod. Ang priority mo, action mo dito is to submerge 1 inch at the end ng tube sa sterile saline. 84B. Nag-SSD na ba? SSD daw. Ano ba? Makakapunch lagi ng time, oy. Number 84. Okay na ba? Nag-SSD na ba? Ano? Ay, ang gabi niyan. Sir Kenneth yan. Okay na ba? SSD na guys. Go, go. Number 85. While the nurse and the client was doing... Number 85. Padayon na, ma'am. Oh, sorry na ha. Number 85. While the nurse and the client was doing ROM exercises, the chest tube was inadvertently pulled out. So, kanina na-dislodge sa drainage system. Ngayon, na-dislodge wala sa pasyente ang concept. Ang tanong, Nurse Zoe's immediate reaction is to cover the site insertion with, ika-cover mo daw yung site kasi na-dislodge yung tube. Ano ang gagamitin mong pang-cover? Moist, sterile, vaselinized, petroleum, or dry? Ang gandang tingnan nung may sterile, no? Tanggalin na natin yung vaselinized at yung petroleum. Nasa moist or nasa dry? Two opposing options. Tama po tayo, letter D. Tayo po ay magdadry, ayaw po natin ng moist dahil ito po ay occlusive dressing. Pag naglagay ka ng occlusive dressing, it is no different from clumping. Dahil mag-promote din po ito ng tension pneumothorax. By putting a dry sterile dressing, we are allowing air to escape and this will prevent pneumothorax. And by doing test-taking strategy, titingnan mo po yung options A, B, C. Pare-parehas lang po sila. Kung mali po ang vaselinized at petroleum, they are both moist. So kung mali po ang B and C, matik malindi po ang A mo. So ang option na matitira sa iyo is letter B, 85 letter D, dry. 86. Situation, Marlene Chapman, a 24-year-old, is sales clerk, reports weakness, fatigue, and general malaise. There is pallor of the skin and mucous membrane. The nurse obtained health history which reveals that the patient has anemia. Present hemoglobin level is less than 8.0 grams per DL. Napakababa po. The physician ordered for transfusion of packed RBC. Nurse Angie knows that she needs to perform a venipuncture in a suitable way using what gauge of IV cannula? Ang tinatanong sa iyo, gauge ng IV cannula. Okay. Pag nagbibigay po tayo ng packed RBC, ang atin pong gusto yung pinakamalaki para po hindi ma-destroy at masira yung RBCs natin. We prevent destruction of RBCs. Ano po ang pinakamalaki dito? 20 or 18. Dahil po when we are talking about cannula, the lower the number, the bigger the size. The lower the number, the bigger the size. So 20 and 18 gauge, yun po ang pinakamalaki natin dito, number 86D. 87. Blood transfusion is a nursing responsibility that requires both knowledge and skills critical for patient safety. Blood transfusion ang topic. Nurse Ansher reviews the correct procedure of blood transfusion, which includes all of the following, except correct procedure, except negative ang hinahanap natin. Isotonic solutions such as LR are the only solutions compatible with blood, thereby used during transfusion. Tama po ba to? Do not transfuse unit of blood for longer than 4 hours. Tama po ito. Dahil after 4 hours, nagkakaroon na po ng bacterial contamination ang dugo. Pag naka-expose po ito sa room temperature more than 4 hours, nagkakaroon po ng bacterial contamination. So transfusion should not be longer than 4 hours. Close monitoring of the client for 15 minutes from the start of infusion. Tama po ito. Critical po ang first 15 minutes dahil dyan po naglalabasan ang blood transfusion reaction. During the first 15 minutes, transfuse po tayo in a rate of 20 drops per minute or 1 to 2 ml per minute. Tama po ito. Bakit? Ang yung 20 drops per minute is mabagal. Sinasadya po natin na ganito dahil po ang 20 drops per minute, pwede ka pong magkaroon, it is capable of giving transfusion reaction to the patient but not severe enough. So magkakaroon ng blood transfusion reaction if ever it will happen, pero we are still capable of reversing it. Kaya mabagal po tayo sa first 15 minutes. And then after 15 minutes, full blast na po yan para mabilis ang transfusion. Ang mali po dito, exception is letter A. Tama po yung isotonic fluid. Isotonic fluid po talaga ang ginagamit natin, pero mali po ang LR. NSS lang po ang ginagamit natin, guys. Hindi po pwede ang LR o kahit anong isotonic solution. NSS lang po ang IV fluid that is compatible in your blood transfusion. Number 87 is letter A. 88. The blood product was obtained by Nurse Angie from the lab and was stored in the unit refrigerator in the nurse's station. The patient requested to eat his lunch first. Sabi niya, kakain muna ako, mamaya na. 25 minutes had passed, 25 minutes na. The patient still wants to delay the transfusion. What is the appropriate nursing action? Letter A. Ensure to store the blood in the unit refrigerator. Hindi po. Hindi po. Dahil ano po unit refrigerator is hindi precise ang temp. Hindi maganda ang temp. So kahit ilagay mo dyan doon, tapos na pala yung PNP talaga. Kahit ilagay mo po sa unit refrigerator yung blood, hindi pa rin po maganda ang kanyang preservation dahil hindi po precise ang temperature dito. Immediately transfuse the blood product as lysis may occur in 24 hours. Makakasuhan na po ng battery kasi tumatanggi pa po yung pasyente eh. As the patient is still refuses, hindi mo pwedeng ipilit yan dahil makakasuhan ka ng battery, guys. Call the physician to inform na ayaw, na dinidelay pa ng pasyente. So nagsumbong ka, sasabihin sa'yo ng tutor, okay, ano gagawin ko dyan? Kasi nagsumbong ka lang. Ang gagawin mo is letter B. You return the blood product to the laboratory within the first 30 minutes. May tinatawag po tayong 30-minute rule. In the first 30 minutes, pagkatapos ilabas sa laboratory yan, ang RBC na iniwan sa room temperature is magkakaroon ng bacterial growth. So in the first 30 minutes, kung hindi mo pa siya matransfuse sa patient, ibalik mo sa laboratory. Return the blood product to the laboratory within the first 30 minutes. 88B. 89. 10 minutes after the transfusion, 10 minutes pa lang, nag-complain ang pasyente ng headache. The nurse assesses that the client has light shortness of breath and she feels warm to touch. So nagkakaroon ka dito ng blood transfusion reaction. What action by the nurse is priority? Anong priority mo? I-slow mo lang yung rate, hindi po prepare resuscitation, OA po ito, hindi pa naman namamatay yung pasyente. Notify the client's physician is the next thing na gagawin mo pagkatapos mong i-discontinue. Ang discontinuation will prevent further complication dahil ang pasyente po ay nagkakaroon na ng reaction. So ang pinakauna mong gagawin, discontinue to prevent further complication. After mong discontinue, immediately notify the physician. Ang unang mong gagawin is letter B, 89. 90. Most adults can tolerate receiving 1 unit of blood 1.52 hours. If blood product is transfused faster, mas mabilis daw. Mas mabilis. That the circulation can accommodate, ano ang complication na pwedeng mangyari? Sepsis, nangyayari po ang sepsis pag contaminated ang blood product. Contaminated ang blood product. Nagkakaroon po ng hemolytic reaction pag mayroong incompatibility. Incompatible yung donor at yung recipient. Nagkakaroon po ng anaphylactic reaction pag mayroong antibody-antigen reaction between sa blood product and sa recipient ng blood sa blood ng recipient at sa blood ng donor. Ang nangyayari po pag faster ang transfusion is circulatory overload. Circulatory overload, 90C. Situation number 91. Cian is a 5-year-old boy. He was brought to his mother to the hospital for a productive couple of 6 days. May ubo siya na may plema na 6 na araw na. The mother asked Cian forcefully cough in an attempt to expectorate. Gustong ilabas ng bata. The physician ordered for chest X-ray and results show for a focal lung opacity at the base of the lungs. May focal lung opacity sa base ng lungs. Ganito yung lungs mo. Ay, ang pangit. Ito yung lungs mo, ito yung apex. Ito yung base. So, nandito yung focal lung opacity sa base. The physician ordered for chest physiotherapy, CPT, chest physiotherapy. The nurse knows that the sequence follows as. Ano po ang tamang sequence ng iyong CPT? Ang tinatandaan ko po dito ay ang tinatawag na Pope the Sixth. Pope the Sixth. PO for postural drainage, PE for percussion, VI for vibration. Ito po ang tamang sequence. Ipo-postural drainage mo muna, then ipo-percuss mo, then you do vibration. Madali po siyang tandaan. Tandaan mo yung code Pope the Sixth, POPEVI. Letter B, number 91. 92. All of the following is appropriate time to perform procedure except. Negative ang hinahanap. Before bedtime, yes po, magandang gawin ng CPT before bedtime para po ma-expectorate yung mga plema, and it will promote comfort, maganda ang tulog ng pasyente. Late afternoon, yes po, dahil less ang visitor. Sabi ni Kushir, we do CPT in the afternoon dahil ito po ang pinaka-less ang bisita daw. An hour before lunch, yes po, dahil empty ang stomach. Dahil po ang iyong general concept, when you are doing CPT, dapat po empty ang tiyan. Bakit? To prevent aspiration, kasi minamanipulate mo dyan yung pasyente, positioning, nagpe-percuss ka, nag-vibrate ka, so pwede kang mag-cause ng aspiration. So ang iyong concept po dyan is dapat empty ang stomach. An hour before lunch, empty po ang tiyan. Early in the morning is tama po. Actually, ang ideal time is early in the morning talaga, pagkagising ng pasyente. Dahil habang tulog ang pasyente, yung mga plema po niya is parang naiipon sila pagkagising niya sa umaga. So, yun yung perfect time. Kaso lang, mali po yung after breakfast. Dapat po before breakfast. Kasi ang concept po natin is empty stomach. So, ang perfect time po ng CPT is early in the morning before breakfast. Exception, letter A. Number 93. Chest X-ray shows focal length opacity at the base of the lungs. Ito po yung drawing ko kaninang parang lungs. Tapos nandito po yung focal lung opacity sa base. In performing postural drainage, in what position should the nurse put siyan? Ang postural drainage po, ang purpose mo dyan is to drain yung secretions. So kung i-drain mo siya, dapat elevated yung part kung nasaan yung mga plema. So kung nandito kang sa base, kailangan mong i-elevate yung base. Paano mo i-elevate yung base? Semifowlers, no. Nakataas pa din po, nandito pa din ang apex mo, nasa baba pa din po ang base. Mali po ang semifowlers, mali din po ang high fowlers, and hindi din po makakatulong ang semifowlers. Ang tamang position po ay trendy. Kasi pag naka-trendy ka, nandito yung ulo, nandito yung chest, nakataas po ba ang base ng lungs? Nakataas ba ang base ng lungs, guys? Nakataas ba ang base ng lungs? Yes po, nakataas ang base ng lungs. Will this promote drainage by virtue of gravity? Yes po, yan po ang concept ng postural drainage. You elevate the lung, the area affected, and then yung po ay magpropromote ng drainage from base, mag-drain po siya pababa. So you position the patient in a Trendelenburg position as this promote drainage. Number 93B. 94. Percussion, sometimes called clapping, is forceful striking of the skin. Okay. Hindi ko ma-demonstrate kasi hindi po naka-on ang aking camera. So parang naka-cup ang iyong kamay, yan po ang nangyayari sa percussion, and then forceful striking po siya ng skin, naka-cup hands. And alam mong tama ang ginagawa mo, the procedure is correctly done pag nandito yung ratio. It starts percussing from shoulders downward. Mali po ito. Percussing is going up. Going up po. I-ratio to ha. Ratio hindi natanggal. Mali po yung is percussing from shoulder downward. Dapat po going up. So nag-i-start ka from the lower back upwards. Percuss the affected lung segment for 30 seconds. Masyado pong maliit yung 30 seconds. Ginagawa po natin ito for 1 to 2 minutes. Letter C or letter D? Perversion is done along the backbone. Hindi po tayo nag-clapping sa may backbone dahil nandito po yung spinal cord. Ayaw po natin na apektuhan yung spinal cord. Yung mga areas to avoid po during percussion is yung breast, yung spinal cord, yung spinal column at yung sternum at yung kidneys. So ang correctly done po dito is pag nagpe-percuss ka and it produces hollow popping sound, yan po ang iyong percussion. 94C. 95. After performing the procedure, the nurse evaluate for effectivity. Nag-evaluate na po ng effectivity ng CPT. Paano natin malalaman na effective yon? Which of the following does the nurse expect pag effective yung CPT mo? Patient coughs effectively, tama ba to? Adventitious breath sounds. Pag sinabi natin adventitious, abnormal. So ayaw mo nito. Increased RR, meaning pag increase ng RR, nahihirapan pa din huminga ang pasyente. Mali din po ito. Ang patient coughs effectively, goal mo yan ng effectivity pag ang tinuro mo is effective coughing technique. effective cupping technique. Yan ang goal mo. Pero kung nag-CPT ka na ang purpose ng CPT is to clear the secretions in the lungs, ang iyong goal dyan is clear breath sounds. Pag clear na po ang breath sounds, meaning wala na pong secretions na nakakablock sa paghinga ng pasyente. Sagot number 95 is letter D. Number 96, ethics po tayo. Number 96, ethics. Healthcare professionals generally operate under a legal practice act that outlines activities their providers perform in the delivery of patient care and develop a code of ethics to assist in self-regulation. 96, a nurse must take care of a patient with AIDS and cannot refuse to do it even if the condition may threaten her health. What ethical principle applies to the situation? Ano po ang ethical principle sa ganitong sitwasyon? Ang virtue ethics, hindi po. Ang virtue ethics is a nurse believe that the heart of a person performs all its action, hindi po. Divine command ethics, ito po yung may supreme being na pinaniniwalaan natin lahat, hindi po applicable situation. Teleological or deontological? Teleo or Dion? Sagot, Dion. Pag sinabi natin Dion, duty-centered. Duty-centered. So makikita po natin dito na kahit may AIDS ang patient na may threaten her health, hindi po siya pwedeng mag-refuse because it is her duty to take care of the patient. Teleological, ito po yung the right thing to do is the good thing to do. For this specific situation, ang applicable po is deontological, duty-centered, letter B. 97. Although the client refused the procedure, the nurse insisted and inserted a nasogastric tube. Ayaw ng pasyente pero nag-insert pa din. The administration of the hospital decides to settle the lawsuit because the nurse is most likely to be found guilty of which of the following? Battery. Battery. Yung battery po is anong definition natin ng battery? Willful touching of a person without permission. Battery. 97D. 98. The primary care provider, note a DNR, do not resuscitate. Order, the nurse recognizes the breach of life in the planning of nursing care for this client. The client may no longer make decisions regarding his or her own health. Hindi po. Pwede pa rin pong mag-decide ang patient. Letter D, a DNR order from previous administration valid for the current admission? Hindi po. Ang DNR po is valid lang doon sa mismong admission niya. Letter B, the client and the family know the client most likely to die. Tinaningan mo, mali din po to. Tama sagot, letter C, the nurse will continue to implement all treatments focus on the comfort and symptom management. Magpa-palliative care at mag-hospice care ka pa din sa pasyente kahit naka-DNR na siya. Ang ibig sabihin lang ng DNR is hindi ka na magagawa ng mga heroic action to save the client's life in moment na mag-toxic siya. Pero you will still deliver palliative and hospice care, 98C. 99. A client woke in the middle of the night, confused and unaware of the surroundings. Although the light was within reach, mayroon kang call light within reach. Ginagay ng nurse. The client got out of bed and assisted. Tripped on the bedside chair and fell. Which of the following elements in malpractice is missing in this case? Ano po ang element ng malpractice na hindi natin nakita sa situation na ito? Letter B. Andito yung ratio. B and C, both present. Kasi po, na-trip siya and na-injure siya. Nahulog, so present po. Duty po was addressed. Na-address po yung duty kasi po yung call light was within reach. So ginawa po ng nurse yung responsibility niya. Ano po yung tinatawag natin foreseeability? Yung foreseeability, ito po yung link ng act ng nurse and the injury suffered. Ibig sabihin po, nakikita nurse na posibleng mangyari ito, pero nagpabaya siya. Yun po yung foreseeability. But in this case, hindi naman po nakita ng nurse na pwedeng na the patient will go out of bed and assisted, tapos nahulog siya. Hindi po alam ng nurse yon. So foreseeability po ang element ng malpractice na hindi natin nakita sa case na ito. 99A. 100. Aray. Mrs. Gomez, who has cancer of the uterus, submits to hysterectomy, and she will no longer be able to bear a child.
But if she will not undergo the surgery, cancer cells may metastasize to other parts of the body. It is the physician's intention to help her and not to harm her. Ano ang moral principle na nag-apply sa situation? Utilitarianism is the greatest good for the greatest number. Hindi po applicable. Paternalism, ito po yung the right to decide for another person. Yung iba po yung taong nagde-decide para sa pasyente, hindi din po. Ang epekya isang tinatawag natin na exception to the rule. Ang applicable po sa situation na ito is two-folded effect. Ito po yung nagkakaroon ng dilema na kailangan niya mag-submit to hysterectomy para hindi siya mamatay, hindi siya mag-metastasize yung cancer niya. And meron po itong kasamang negative effect na hindi na po siya makakapag-anak. Ang tawag po dito is two-folded effect. Okay. Are we guys good sa ating first 50 items? Are we good in our first 50 items? Okay, babalik ako dito. Guys, wala pong dinner break. Magbe-break po tayo ng 15 minutes lang. Kain na po kayo. Guys, kain na po kayo. 15 minutes break lang po. Dahil 4 hours lang po ito. Okay. Ma'am, sa number 85 po, hindi po ba dapat occlusive dressing pag na-dislodge ang tube to avoid the entry of air? Salamat po. Okay. Ganito po ang concept, no? Hindi po talaga dapat occlusive kasi mayroon din pong air sa thorax. Pag maglagay ka po ng occlusive dressing dyan, matratrap po yung air. Ang purpose po ng CTT, kaya naglagay tayo ng CTT is para palabasin yung air, di ba po? So kung mag-occlusive dressing ka dyan, matratrap yan, mag-pneumothorax yan, pwedeng mag-respiratory arrest ang pasyente. Mas mataas po yung risk ng pneumothorax pag hindi lumalabas yung air kesa po yung possibility ng air entering the lungs. Dahil po in that case, mas mataas po ang pressure sa loob ng thorax. So mas mataas po ang risk na mag-stay yung air sa loob ng thorax, mag-cause ng pneumothorax kesa ang air ang pumasok sa thorax area mo. Naintindihan po ba ang part na yon? Okay po. Thank you, ma'am. Alam niyo guys, Pete, pag meron akong hindi naintindihan sa ratio, hinahanap ko siya agad sa libro. Lahat po ng dinidiscuss natin, especially ng yung funda, nasa Kushir po. Lahat ng ratio ay kinukuha sa libro, especially po dito sa part ng funda na kay Kushir po. You can check them sa mismong book. Mag-NP4 po tayo. Ayusin ko, wait lang, sa PPT is, how do I go on this? Sa 15 minutes break. So, nag-start po tayo ang break ng 7:20. So, dapat nandito na po kayo sa 7:35. Opo, nag-break na po tayo, ma'am. Ma'am Epi, nag-break na po tayo. Ng 7:20, babalik po kayo ng 7:35. 15 minutes break, mag-dinner na or grab anything to eat. Exit.
Balik na po tayo. Okay. Tapos na po ang break, ang 15 minutes break. We will now be doing NP4 items 1 to 100. Ang matapos po natin hanggang 10 p.m. Sana makatapos po tayo ng at least 75 out of 100 ngayong gabi. Para hindi po tayo mag-wrap bukas. Para hindi po tayo mag-wrap bukas ng ating last 2 hours. Okay na po ba yung sound ngayon? Nakikita na po ba ulit yung screen?
Yes, ma'am. Okay na.
Okay. Okay, we will now be doing NP4 items 1 to 100. Ito po ba ang number 1 ng iyong NP4? Yes, okay. Situation, Francis is a 52-year-old firefighter hospitalized with the diagnosis of AKI, acute kidney injury, resulting from rhabdomyolysis. Francis is acutely ill upon admission and experiencing altered level of consciousness. The following are true about ARF or acute renal failure except. Ano po ang hindi tama? It is a sudden loss of renal function. Tama po ito. Sudden means acute. It has good prognosis. Tama po. Ang acute renal failure is reversible. In opposite sa iyong chronic renal failure na irreversible. Good prognosis po, reversible ang acute renal failure. Patients with ARF undergo 3 different stages. Yes po, may 3 stages ang iyong ARF. Ang oliguric, diuretic, and recovery phase. Ang mali po dito is letter D. Sa iyong acute renal failure, renal tubules lang po ang damage. Ang iyong glomeruli, they remain intact. Remain intact ang glomeruli. Dahil po, pag na-damage na din ang glomeruli, katulad nangyayari sa iyong chronic renal failure, nagiging irreversible na po ito. Ito po ang nangyayari sa iyong chronic renal failure. Number 1, letter D. Number 2, Francis is in the oliguric phase of AKI. What does the nurse anticipate as the daily urine output will be? Pag sinabi po nating oliguric, decreased urine output, lower than normal urine output. Ito po ang nagyayari pag nasa oliguric phase ka ng AKI. Ang 1.5 liter po, ito po yung normal urine output mo in 1 day. Ang 1 liter po, mas mababa sa normal, pero hindi pa po ito kinoconsider na oliguric. Sinasabi po natin na oliguric na po ang pasyente pag ito po ay less than 400 ml na. Letter C, hindi mo na kailangan maghintay na less than 50 ml para sabihin mong oliguric. Less than 400 ml a day is oliguric. Number 2, C. Number 3, it is the longest phase in the stages of acute renal failure. Tatlo lang po, wala po tayong tinatawag na renal impairment. It's oliguric, diuretic, and recovery phase. Ito po ang 3 stages. Your oliguric phase is 1 to 3 weeks. Ang iyong diuretic phase, ang pinakamaikli is only 1 week. Ang pinakamahaba po, longest phase is your recovery phase. It is 3 to 12 months, depending po kung saan libro ka nakatingin. Sometimes it's only 3 to 6 months, 5 to 10 months. Ito po yung pinaka-widest range. Shortest, 3 months, longest, 12 months. Recovery phase, 3 to 12 months. Number 4, the nurse is caring for a patient after kidney surgery post-op. What major danger should the nurse closely monitor for? Pag sinabing major danger, closely monitor for, ang tinatanong sa'yo, complication. Complication. Anong complication daw ang kailangan mong bantayan? A, abdominal distension owing to reflex cessation of intestinal peristalsis. Yes po, nagkakaroon naman ng reflex cessation ang iyong intestinal peristalsis. Pero major danger ba ang iyong abdominal distension? Hindi naman po. Ang
Parehas lang po yung yung A and C. Ang paralytic ileus is also caused by manipulation of the colon during surgery. Pero hindi naman po sila ganun ka-dangerous. Hindi naman po sila life-threatening. And pneumonia ba or hypovolemic shock, B or D? Ang tamang sagot is letter B. Ang pneumonia po caused by shallow breathing because of severe incisional pain. It happens, is a complication that may also happen post-op. Pero in comparison to hypovolemic shock that is caused by hemorrhage, ito po yung mas delikado kasi we're also putting into consideration the ABC of life. Pag nagkaroon ng bleeding yan, hemorrhage after kidney injury na mag-hypovolemic shock, pwede yung mag-cause ng immediate death sa pasyente. Number 4B. Number 5. Nurse Mira knows the complication brought about by chronic abnormal kidney function. Chronic na po ang pinag-usapan natin dito. Chronic abnormal kidney function. She promotes safety by ensuring that the patient... Okay, pag-usapan po natin ang chronic abnormal kidney function. Pag ang kidney po abnormal ang function, hindi po niya na ilalabas yung mga toxins at yung ibang electrolytes na dapat nilalabas niya. Isa po doon is yung phosphorus. Phosphorus. So ang nangyayari po dyan, dahil hindi na ilalabas yung phosphorus, tumataas po siya sa dugo, nagkakaroon tayo ng tinatawag na hyperphosphatemia. Ang relationship po ng phosphorus sa iyong calcium ay opposite. Katulad ng sodium at potassium na pag mataas ang sodium mo, di ba? Alam mo ang concept na to, pag mataas ang sodium mo, mababa ang potassium mo. Ganun din po ang relationship na iyong phosphorus at ng calcium mo. Pag mataas ang phosphorus mo, mababa ang calcium mo. So pag may chronic kidney function, hindi na ilalabas ang phosphorus, tumataas siya, ang nangyayari, bumababa ang calcium sa dugo. So ang ginagawa ng katawan mo dito, para tumaas ang calcium mo, nai-stimulate ang iyong tinatawag na parathyroid gland at nagre-release siya ng parathyroid hormone. Parathyroid hormone. Ang function po ng iyong parathyroid hormone ay yung tinatawag nating osteoclastic activity or bone breakdown. Osteoclastic activity, bone breakdown, function po ng iyong parathyroid hormone. Bakit po niya kailangan mag-bone breakdown? Para po yung calcium na nasa bone is mapunta sa blood. Bini-breakdown niya po yung bone para yung calcium na nasa bone is mapunta sa blood para tumaas ang level ng iyong calcium dahil initially mababa po ito dahil sa chronic abnormal kidney function. Ang nangyayari po dahil nagbo-bone breakdown ka para pataasin ang calcium, na pwede po ang patient maging at risk sa tinatawag nating pathologic fracture. Pathologic fracture. At risk na ang patient sa pathologic fracture because of bone breakdown. So to promote safety, nalaman mo na ang lahat ng to. To promote safety, ano ang sagot mo? Sa number 5. Naintindihan po ba ang pinag-usapan na pathophysiology? Yes, letter A. Dahil ang patient po is at risk na ngayon sa pathologic fracture. You should let the patient wear low-heeled shoes and avoid wet places to avoid fall. Number 5A. Situation. Pwede po bang i-improve ang handwriting? Sorry po. Okay, I will try. Susubukan ko po. Yes. Sorry na. Number 6, situation. Mr. Tan is a 67 years old business owner and was brought by his daughter, Elise, to the hospital due to difficulty urinating. Nahihirapan pong umihi. In the past few days, after assessment and diagnostic exams, na-diagnose si Mr. Tan ng BPH or benign prostatic hyperplasia. Gagandahan ko po ang sulat. The following are true about BPH, exact. Mali po ang hinahanap natin. Sabi, the cause is unknown. Yes po, in BPH, the cause is unknown. Pero one of its leading contributory factor or risk is the aging process. Aging process ang risk mo for BPH. BPH, aging process. Bakit po? Anong nangyayari? Pag tumatanda ang pasyente, pag tumatanda ang lalaki, nagkakaroon ng mga hormonal imbalances. Normally, sa lalaki, mas mataas ang testosterone kesa sa estrogen. But because of aging at nagkakaroon ng hormonal imbalances, mas tumataas po ang estrogen kesa sa testosterone. This rise in estrogen causes hyperplasia sa iyong prostate gland. At nagkakaroon po ng overgrowth ng normal cells sa iyong prostate gland kaya lumalaki. Kaya nagkakaroon ka ng tinatawag na benign prostatic hyperplasia. Tama po ito dahil ang aging process is not a cause, it is only a risk. This leads to urinary obstruction. Yes, kaya po nagkakaroon ng difficulty urinating. Nocturia is the initial manifestation is also a yes. Ang earliest sign po or initial manifestation nocturia, ihi sa gabi. Ang exception po dito is letter A. PPH is common not in 70 years old and above, rather 50 years old and above. Number 6A. 7. Elise asked Nurse Mao what causes the difficulty in urination in her father. Nurse Mao answers correctly by stating positive ang hinahanap, correctly. An infection is present in the urinary tract. Hindi po ito dahil ito po ay UTI. Scarring of the inner lining of the prostate, hindi po scarring ang nangyayari sa iyong BPH, mali din po ito. B or D? Ang di po, sabi, hyperplasia of the prostate causes complete compression of the urinary bladder. Mali po, hindi po complete. Ang nako-compress lang po is ang base ng bladder. Gradual enlargement of the prostate gland causes compression of the urethra. Check. And base lang po ng bladder, hindi complete compression of the urinary bladder. Number 7B. Number 8. The physician is scheduled Mr. Tan for retropubic prostatectomy. Retropubic prostatectomy. Nurse Mao knows that this surgical procedure involves, pag sinabi nating ectomy, removal. Pag sinabi nating prostate gland, removal of the prostate gland. Removal of the prostate. Pag sinabi nating retro, nasa baba yan, lower. It's just a matter of keyword, guys. So pag sinabi nating prostatectomy, removal of the prostate, matik, tanggal na po ang letter A. Ano po ang tinatawag natin na excision of the prostatic tissue using a resectoscope? Ito po yung tinatawag nating term. Transurethral resection of the prostate. Transurethral resection of the prostate, term po ang letter A. Excision of prostatic tissue. Gumagamit po ng instrument na tinatawag na resectoscope, ipinapasok ito sa penis via the urethra papunta sa prostate gland. Kinakayod po yung mga hyperplasia ng cells sa loob ng iyong prostate. Yan po ang tinatawag nating TERP. So nandito na po tayo B, C, or D. Pag sinabi mong incision made between the scrotum and the anus, ano po ba yung area between the scrotum and the anus? Yun po ang tinatawag nating perineum. Kaya ang tawag po dito is perennial prostatectomy. Perennial prostatectomy dahil ang site po ng incision is sa perineum. Letter B or letter D? Sabi po natin retro, meaning lower. Ang incision po ay ginagawa sa lower abdominal, sa lower abdominal incision. Pag sinabi po natin ang incision ay through abdominal and bladder incision, ito po ay suprapubic. Suprapubic. So ang iyong retropubic prostatectomy is letter C. 8C. 9. Continuous bladder irrigation or CBI. CBI po is one of my favorite topics sa funda. Continuous bladder irrigation or cystoclysis was ordered for the patient post-operatively to irrigate the bladder. Which of the following is a correct nursing care in a patient with CBI? Familiar po kayo sa iyong tinatawag na Foley catheter na two-way. Yung Foley catheter po nyo, ganyan siya. Yan po yung commonly na nakikita nyo sa hospital, di ba? Ito po yung port kung saan nag-insert ka ng air to inflate the balloon. Ito po yung port na nakakonect sa urobag. But when we are talking about continuous bladder irrigation, ang ginagamit po dito is three-way catheter. Meron pa po ditong isang tube kung saan may nakakonect na irrigant. May nakakonect na IV solution na patuloy ang pagpasok. Yung irrigant mo po na IV solution sa pangatlong port, dahil ito po ay 3-way catheter, pumapasok po siya dyan papunta sa iyong prostate gland. Ang purpose po ng iyong continuous bladder irrigation is to irrigate the bladder. Dahil po pag magkaroon ka po ng iyong nag-perform ka ng TERP, katulad ng pag-usapan natin kanina sa TERP, na kinakayod yung tissues at yung kinakayod yung tissues, may naiiwan pong tissues doon at mayroong blood. So para matanggal yung mga naiiwang tissues at blood, nagkakaroon po ng irrigant. And then lumalabas po yung irrigant, kasama na yung blood, kasama na yung tissues, lumalabas siya sa iyong urobag. Parehas pa din po ang function ng dalawang port na to for balloon inflation, for connection sa urobag. Mayroon ka lang pong additional na port for irrigation. Yan po ang gamit ng iyong continuous bladder irrigation. Nagets po ba ang part na yon ng CBI? Ang tawag po natin dyan is cystoclysis. Which of the following is the correct nursing care? Ang tinatanong sa'yo, correct nursing care in a patient with CBI. If drainage is reddish daw ang drainage ng CBI mo, reddish daw yung lumalabas dito, i-decrease mo ba ang flow rate? Hindi po. Ang gagawin mo dito is increase. Dahil pag reddish po ang CBI, ang lumalabas sa iyong irrigation, meaning po concentrated. So instead of decreasing, i-increase mo ang flow rate ng continuous bladder irrigation para mas ma-irrigate ng maayos. Letter D, instruct the client that the urge to void or sensation bladder forms should be immediately reported. Hindi po ito should be immediately reported. Dahil po pag nag-i-insert ka ng iyong catheter, pag nag-inflate ka ng balloon, ito po ay nagpuput ng pressure sa internal sphincter. Yung balloon na inflate mo, nagkukos ng pressure sa internal sphincter. Ang mararamdaman po ng pasyente ay para siyang naiihi. Parang pakiramdam niya puno ang bladder niya. So that's normal and expected and you have to inform the patient of that. Okay, wala. So hindi mo kailangan immediately i-report. Use hypotonic fluid solution as irrigation, hindi po. Ang ginagamit natin dito is isotonic. Dahil po pag gumamit ka ng hypotonic, magkukos po ito ng ng water intoxication. Ang hypotonic fluid po is mababa ang kanyang concentration compared ng concentration ng body fluid. So ang mangyayari po dyan, pag nagbigay ka ng hypotonic fluid, ang water po ay papasok sa cell, magkokos ng cell to swell. Yun ang nangyayari, di ba, sa hypotonic fluid. It causes cell to swell dahil ang fluid po ay pumapasok sa cell. Magkokos po ito ng water intoxication. So ang ginagamit po nating irrigation is isotonic fluid. Ang tama pong correct nursing care is letter B. Instruct the client to increase fluid intake. Bakit po? To prevent dehydration and to prevent constipation. Dahil po pag constipated ang pasyente, magi-strain po yan, magmabalsalba maneuver, magkukos ng spasm, and this will lead to bleeding sa iyong bladder. 9 is letter B, increase fluid intake. Nakakasunod po ba tayong lahat? Nakakasunod po ba tayong lahat? Kaya binibilisan ko po sa kaninang part dahil may mga part po na kailangan talagang i-explain. Number 10. Upon removal of the catheter, what important instruction does nurse Mao emphasize to Mr. Tan? Nag-remove ka na ng catheter, ng continuous bladder irrigation na linagay mo sa pasyente, and sometimes it took long before mo tatanggalin yung catheter. So ang nangyayari, ito ang urinary bladder mo. Normally, ang organ, kahit anong organ yan, pag napupuno yan, nagdi-distend, lumalaki. At ang organ mo, at ang bladder mo, pag nadi-distend siya, it sends signal to your brain na brain, puno na ako, palabasin mo na yung ihe. Nagsisend ang signal ng brain mo at nagko-contract siya pabalik sa kanyang original na position, and dito ka nakaka-feel na naiihi ka kasi nagko-contract na siya. Nadi-distend pag napupuno ng ihe and nagko-contract para ilabas yung ihe. Pero pag may catheter ka dyan, syempre pag may catheter ka, pagkakapasok ng ihi na galing sa kidney mo at sa ureters mo, labas na yan, nagko-contract, labas lahat yan. So for a long time na nakakatheter ang pasyente mo, hindi na siya nakakaramdam ng sensation na naiihi siya dahil hindi na nagdi-distance, hindi na contract. Upon removal ng iyong catheter, hindi na sanay ang urinary bladder mo. So ano ang dapat mong ituro sa pasyente upon removal? Important instruction upon removal of the catheter. Advise vigorous exercise and sexual activity. Pagkakita mo pa lang ng vigorous, mali na. Ayaw natin ng mga bad words na katulad ng vigorous. Maintain proper hygiene is good, but this has nothing to do with an instruction na helpful sa removal ng catheter. Straining and cross-leg setting is fine daw as long as bleeding is no longer mga pasyente na normal. And cross-leg setting, kaya nga po bawal to para hindi mag-bleed. So pag hindi na mag-bleed, gagawin mo na. Mali din po ang letter B. Ang tama po is letter C. You do Kegel exercises sa buntot, diba? Contract mo yung perineum. This is para masanay ulit yung bladder mo na nagko-contract siya at nagre-relax. Due to prolonged insertion of catheter, hindi nasanay. So it should be retained para ma-retain po ang iyong ma-regain po ang urinary control. Mamlag. Lag pa din. Lag pa din. How about now? No na po. No na po. No na po. Okay. Ngayon, are we good? Okay na po. Okay na po. Nasundan po ba yung number 10 kung bakit Kegel exercises to regain urinary control, kinukontract yung perineum to regain contraction. Number 10C. Number 11. Sabihin ka agad kung naglalag ha. Okay. Ngayon okay naman tayo, no? Number 11, Mr. Puna is a 54-year-old self-employed. He presented to the ER with frequent episodes of chest tightness. Chest tightness po relieved with rest. Nurse Dimple inspect for initial cardiac assessment. Ang pinagko-compare po natin dito is angina pectoris, and myocardial infarction. Pag sinabi po natin relieved with rest, ano po yan? Pectoris or MI? Relieved with rest. Pectoris po, ang iyong MI is unrelieved with rest and nitroglycerin. Number 11, yes, pectoris. Upon assessment, which of the following Nurse Dimple will not expect for the patient to manifest? So ang ini-expect natin dito is angina pectoris. Ano po ang consistent sa angina pectoris in the following option? Patient complains of precipitated pain when walking to the bathroom. Tama po ito dahil po ang iyong angina pectoris is exertion related. The more you work, the more pain. Pain radiates to left shoulder, jaw, and neck. Yes po, nag-radiate po ang pain ng angina pectoris, and diaphoresis also, yes, nag-sweating po, diaphoresis ang patient mo na nag-angina pectoris because of pain and anxiety. Ang mali po dito is pain lasting 45 minutes in duration. Short duration lang po ang angina pectoris mo, 15 to 30 minutes lang po siya. Pag ganito na po katagal, ang duration ng pain, characteristic na po ito ng MI. So, not expect letter D. Number 12, Mr. Pune rested for 15 minutes before the nurse took baseline BP, which of the following is serving as narrowed pulse pressure. Ang pulse pressure po is the difference between your systolic and your diastolic. Minaminus mo ang diastolic mo sa systolic mo. Ang normal na pulse pressure is 30 to 40 mmHg. 150 minus 120, 30 normal. 140 minus 100, 40 normal. 130 minus 90, 40 normal. 140 minus 120, 20 lang, below 100. Narrowed po ba? Yes po, narrowed pulse pressure. 12D. 13. Nurse Dimple performs assessment of the patient's heart. Where would she locate the point of maximal impulse? Naituro po ba sa inyo yung tinatawag na TMAP
TMAP. TMAP. Familiar po ba kayo sa TMAP? TMAP stands for your tricuspid valve, tricuspid. M stands for your mitral. Yes po. Pero meron akong konting ano dito kasi hindi ko ginamit yung exact lang itinuro dito eh. And pulmonic. Ang tinuro kasi sa atin, di ba, TMAP, RL 5522. Pero kung titingnan mo po sa anatomical position po, lalo na pag naglalagay ka ng mga ECG leads, isa lang po ang nasa left side ng sternum. So, ang ginagamit, ay isa lang po ang nasa right side ng sternum. Ang ginagamit ko po dito is TMAP RL 5522. Hindi ko po ginagamit yung itinuro sa RL 5522. Ito po yung ginamit ko. So, paano po natin ini-interpret to? Pag sinabi nating tricuspid, meaning nasa left of the sternum at the fifth intercostal space. Pero pag sinabi nating mitral, nasa left of the sternum at the fifth intercostal space, pero nasa midclavicular line, hindi sa left ng sternum. Nasa midclavicular line siya. Pag sinabi nating aortic, nasa right of the sternum, nasa second intercostal space. Sumusunod po ba kayo dito? Pag sinabi nating pulmonic, nasa left of the sternum, second intercostal space. Ito po yung ginamit kong code para madali siyang memorize. Ang tinatanong po sa'yo, point of maximal impulse. Alam mo na ang point of maximal impulse is makikita mo sa mitral area. Sa mitral area. Nasaan po ang mitral dyan? Ito po. Letter M. Saan mo makikita ang mitral area? Left of the sternum, fifth intercostal space, pero nasa midclavicular line. So, ang sagot po dito is letter B, number 13. Nakuha po ba yun? Mga valve po sila. Yung mga tricuspid valve, mitral valve, yun po yung mga valve. Yung tricuspid valve po, yun po yung valve between your right atrium and right ventricle. Doon ka po nag-listen ng iyong mga auscultatory sound. Hindi niyo po alam yung mga valves ng heart. Ano po yung TMAP? Tricuspid, mitral, aortic, pulmonic. Ito po yung valves ng heart na pinakikinggan natin for auscultatory sounds ng heart. Anatomy po to guys, hindi tayo pwede mag-anatomy ngayon. Oh my gosh, mauubos po ang oras. Code lang po ito na itinuturo ng isang lecturer din sa top rank na ginagamit namin para madaling ma-memorize ang auscultatory sounds ng heart. Hindi ko naman po pwedeng i-discuss sa inyo lahat to dahil mauubos po ang time natin. You can picture it and then you can message me for further inquiry. So, i-message mo ko, ma'am, ano nga po ulit yung TMAP? Sabihin mong ganon. Okay? Move tayo sa number 14. The physician ordered metoprolol. Ang metoprolol po ends with olol. Ito po ay beta blocker for the patient in order to decrease contractility. Which of the following when observed will cause nurse dimple to withhold medication? So, ang purpose po ng metoprolol mo is to decrease contractility. Ang tanong sa'yo, kailan mo i-withhold ang medication? Tanggalin natin ang diaphoresis at ang DAS niya dahil hindi naman po sila connected sa cardio. Brady and tachy are two opposing options. Ang tachycardia po is indication. Yan si Ma'am Maya, ang galing. Ang tachycardia po is indication para magbigay ka ng metoprolol. Kasi pag nag-tachycardia ka, magbibigay ka ng metoprolol to decrease contractility. Ang tanong sa'yo is kailan mo i-withhold? Ang tanong is Brady. Kasi kung bradycardic na ang patient, hindi ka na magbibigay ng metoprolol para i-decrease kasi Brady na ang patient. So withhold medication pag Brady, letter B, number 14. 15. Nakakasunod po ba? Okay pa po ba ang lahat? No po. Hindi na nakakasunod. Number 14 na po tayo. Okay na po ba? Okay pa po ba? Okay. Yes po. Number 15, nitroglycerin therapy was ordered for the patient. Which of the following is not an appropriate nursing intervention for a patient under NTG therapy? Ang tinatanong sa atin, negative. Instruct the client to store NTG in a dark container, yes po, to avoid exposure sa sunlight. Ayaw natin na na-expose sa sunlight ang iyong NTG. So, in-store natin siya sa dark container. Educate client that it's normal to feel tingling and burning sensation when taking the medication sublingually. Tama po ba ito? Normal po ba na makafeel ng ganito ang pasyente pag nagtitake ng NTG? Yes po. Pag naka-feel ng tingling and burning sensation, meaning potent pa po ang medication. Educate the client na normal po maka-feel ng ganito, meaning potent ang iyong medication. Assume sitting position is palaging ginagawa to prevent aspiration. Ang not appropriate po is letter B. Tama po na maximum is 3 doses, mali yung 3 minutes interval. Dapat 5 minutes interval. Number 15, B. Number 16. Number 16, a patient was rushed to the hospital for symptoms of CHF, congestive heart failure. Few minutes after arrival, the patient had cardiac arrest. Congestive heart failure, dumating sa ER, sa hospital, nag-cardiac arrest na. The ER nurse responds immediately, knowing that. The ER nurse responds immediately, knowing that. Letter A, CPR is initiated 4 to 6 minutes after the arrest. Tama po ito. The compression to ventilation ratio is 15 to 2. Mali po ito. Ang ating compression to ventilation ratio is 30 to 2 lang po. 30 to 2. 30 compression to ventilation. Ma'am, pwede po, boy dog. Okay. Boy dog. Binibilugan ko naman. Hindi pa din okay yun. Okay, sige. Boy for letter, ganon. Okay. B, boy. D, dog, ganon. Okay. Sige. Mali po ang letter B kasi 32 po ang tamang ratio. Rib fractures is inevitable. Mali po ito. Hindi po siya inevitable. Kaya po tayo may proper hand positioning. Kaya po may proper hand positioning sa ating pag-CPR kasi avoidable po ang rib fracture. Hindi po siya inevitable. For an unmonitored client, DFEB is done before CPR is wrong. CPR rather is done before DFEB. Pag sinabi po natin DFEB, ito po yung nagdi-defibrillate ka, nagdi-deliver ka ng shock. Hindi po natin ginagawa ang delivery of shock or defibrillation sa patient pag unmonitored kasi may mga readings po ng ECG, may mga readings po ng ECG na hindi dapat natin i-defib. At hindi po tayo nagdi-defib pag ang pasyente po ay pulseless. So hindi po natin alam kung ano ang condition ng pasyente pag ang pasyente unmonitored. So hindi po tayo nagdi-defib. Nagsi-CPR lang po tayo pag isinusugod ng pasyente sa ER. So mali po ang letter D. Ang tamang sagot lang po dito is letter A, apple. Letter A, apple. We initiate CPR within 4 to 6 minutes after the arrest. Ito po ay golden period to prevent hypoxia and cell death. Within 4 to 6 minutes, mag-CPR ka na after the arrest. Number 17. In performing CPR for infants and children, the nurse knows that to assess for circulation, the nurse must check. Hindi po popliteal. Imagine mo, nagsi-CPR ka tapos nag-check ka sa popliteal pulse. Mahirap po yan. Hindi. Ang carotid po is for adult. Radial hindi. Masyado siyang distal. So for CPR ng infants, ang iyong pong pag-check ng circulation brachial pulse po. Letter C, 17. 18. Cardiogenic shock is a state which results from profound left ventricular failure from massive MI. Which of the following is priority nursing intervention? Familiar na po ba sa iba't ibang uri ng shock? Okay, pag-usapan natin ang cardiogenic shock. Ang shock, ang definition ng shock is hypoperfusion. Nawawalan po ng delivery ng dugo sa iba't ibang parte ng katawan, especially
sa mga vital organs na nagkukos ng failure ng vital organs dahil walang delivery ng dugo. Yan po ang shock. Dahil walang dugo, walang oxygen, walang nutrients, nag-organ failure. Yan po ang shock. Pero iba't iba po ang cause ng shock. Isa po doon is cardiogenic shock. Pag sinabi natin cardiogenic shock, meaning ang heart po ang nag-fail. Nag-fail po ang heart mo, hindi na siya nagpa-pump ng maayos, pag hindi na nag-pump ng maayos yung heart mo, wala ka ng delivery ng dugo, hyperperfusion na yan, magli-lead yan to shock. One of the common cause is left ventricular. Kasi po di ba yung left ventricles mo, yan po yung nakakonect sa aorta, tapos nagsisystemic circulation ka. So pag nagkaroon po ng failure sa iyong left ventricles dahil po sa heart attack, massive MI, magkakaroon po siya ng cardiogenic shock. Nagets po ba? Nagets po ba ang ating patophy ng cardiogenic shock? Okay. So ang tanong, which of the following is yung priority nursing intervention mo? Ano ang priority nursing intervention mo sa cardiogenic shock? Tanggalin mo na yung monitor urine output and provide psychosocial support, hindi mo yan priority. A or B, administer IV fluids or administer autotherapy. Nagsashock, hypoperfusion, IV fluid pa, or autotherapy. Gamitin mo yung ABC. May airway problem ka ba? Wala. May breathing problem ka pa? Yes po, O2. May circulation? Yes, pero priority mo pa din ang O2 breathing. Sagot, boy, letter B. Number 18B. 19. Sodium bicarbonate is ordered by the physician for a patient in cardiogenic shock. The nurse knows that this will. Ano po ba ang sodium bicarbonate? Bakit po ba tayo nagbibigay nun sa patient na may cardiogenic shock? Ano po bang nangyayari? Pag mayroong cardiogenic shock, nagkakaroon po tayo ng tinatawag na anaerobic respiration or metabolism. Ito po yung nagkakaroon ng metabolism pero in the absence of oxygen na po. Dahil nga po nagkaroon na ng failure ang heart. Ang end product po na yung anaerobic respiration is mga acid. Ito po yung lactic acid. At dahil po acid siya, ito po ay irritable. Ito po ay nagkukos ng irritation, therefore pain. Kaya ang patient mo na nag-MI, nag-heart attack is masakit ang chest, masakit ang heart. It's because of anaerobic respirations and product lactic acid, may pain. So, ang ginagawa po ng yung sodium bicarbonate, familiar sa bicarbonate, di ba? Pag nag-aaral tayo ng ABG, ang sodium bicarbonate po is increases bicarbonate levels. Ang bicarbonate level po, ito po yung nagbabuffer. Nagbabuffer po siya ng excess na hydrogen ions. So ini-increase niya po yung pH, ini-increase na po ng sodium bicarbonate yung pH, nag-relieve po ng acidosis. Pag increase ang pH, nag-relieve, naglo-lower ang acidosis. Pag nag-lower ang acidosis, nagdi-decrease ang pain. So this is for the purpose of pain relief by lowering the acidosis. So nagbibigay ka ng sodium bicarbonate to relieve what? Lactic acidosis. Nagets po ba ang part na yon? We give sodium bicarbonate in patients who had cardiogenic shock to relieve lactic acidosis. Number 20. For unconscious patient brought to the hospital, the nurse's priority is to unconscious ang pasyente mo. Ano ang una mong gagawin? Priority A, B, C. Perform BLS, open airway. Sinabi na, in-explain na natin, hindi tayo magde-defibrillate. Hindi ka muna tawag ng physician, may gagawin ka muna. BLS, yes, pero ang priority mo pa din is open airway. Kasi kahit mag-BLS ka na, basic life support, kung close naman ang airway, hindi mo pa din matutulungan ng pasyente. Airway is always your priority, pero angkop mo din sa tanong. Hindi po lahat ng panahon, airway ang sagot. Situation. Number 21. Ashton, 26-year-old male, was riding his motorcycle without helmet through the side of the road and hit a cemented wall. He was unconscious as the rescuers arrived and found him. He was immediately sent to the nearest hospital. Number 21, opening the patient's airway. Katulad ng sinabi natin kanina, is priority in the situation. to ensure patient safety with the possibility of cervical injury. So, i-open mo yung airway. Kaso lang, hindi ka sure kung may cervical injury. So, ano ang dapat mong gawin? To ensure patient safety with the possibility of cervical injury, the nurse opens the patient airway using, tanggalin natin yung cervical collar. Cervical collar, ito po yung inalagay sa leeg pag mayroong injury sa leeg. Yung OPA, oropharyngeal airway, hindi mo yan may lalagay sa emergency situation. It's either naka-head tilt ka or jaw thrust. Ito po yung chin lift, head tilt, chin lift. Ito po yung jaw thrust. Ang tamang sugot po is jaw thrust. Kasi makikita niyo po dito sa head tilt, chin lift, itinutulak po dito yung ulo, tapos lift po yung chin. Makikita mo dyan, nako-compromise ang cervical area. So kung may injury po dyan, pwede po yung mag-cause ng further complication and injury. So ang ginagawa mo pag may possibility of cervical injury, nag-jaw thrust ka lang po. Ang ginagawa mo sa jaw thrust, hinahawakan mo lang dito, lag daw. How about now? Hinahawakan mo lang dito and then trinatras mo lang siya para mo lang siyang, para ka lang nagpuput ng pressure dyan sa may jaw, pero you are not compromising the cervical area. Ito po ang safe way of opening the airway pag may possibility of cervical injury. Palaging tatandaan, jaw thrust maneuver 21D. Nakuha po ba ang number 21? Okay. 22. Ashton was suspected to have increasing intracranial pressure. What does the nurse recognize as the earliest sign of serious impairment of brain circulation related to increasing ICP? Nagkakaroon po ng increased ICP. Ang atin pong earliest sign ng increased ICP is decreasing LOC, decreasing level of consciousness. Pero hindi ibibigay sa iyo ang general term na decreasing level of consciousness. Ang ginagamit natin dyan is ang tinatawag na sedelosco. Sedelosco. Alam na po ba ang sedelosco? Familiar po ba sa sedelosco, guys? Yes, okay. So hindi natin isa-isahin para hindi mo consume ang time. Sedelosco, C is confusion, D is orientation, L is liturgy, O is obtunded, S is stuporous, CO for coma. So alam na natin, sabi ni Mamudan, rewording is the name of the game in the NLE. So ang rewording mo ng decreasing level of consciousness is liturgy and stupor. Liturgy, sobrang walang ganang pasyente, stuporous, super antok. D, number 22, dog. 23, the physician ordered for an osmotic diuretic for patient Ashton. The nurse prepares to administer which of the following is an osmotic diuretic? Which of the following is osmotic diuretic? Mannitol po. C. Hindi po glycerin, hindi po isosorbiduria. Ang layo po nila. Ang osmotic diuretic mo dito is mannitol. Pero what if ang question ganito? The physician ordered for an osmotic diuretic na mannitol. Tapos ang tanong sa'yo, what do you expect as a therapeutic effect ng mannitol? Yan ang tanong sa'yo. Anong in-expect mo na therapeutic effect ng mannitol? A, increased urine output. B, increased sensorium. Ano ang sagot? Kung ang tanong sa'yo, nag-deliver ka ng mannitol, anong in-expect mong therapeutic effect? A, increased urine output. B, increased sensorium. Abay, magagaling. Abay, halo-halo ang sagot. Ang in-expect mo pong therapeutic effect ng iyong mannitol is the letter B, increased sensorium. Bakit po? Ang mannitol mo ay isa po itong osmotic diuretic that decreases cerebral edema. Pag nakakatanggap po kami ng pasyente sa ER at ang pasyente po GCS3, may nakahook po dyan na mannitol because it relieves cerebral edema. Pag na-relieve na po ang cerebral edema, kaya siya diuretic kasi magkukos siya na mag-ihi, pero ang main niya na kinukuhang edema is nasa cerebral part. Masyado kang mabilis mag-transfer ng slide or number po. Relieve ang edema by giving mannitol. Mag-i-increase ang urine output mo, pero hindi yan ang... Wait lang. Mag-restart ako ng net. Nag-lag. Okay. So, nag-restart ako ng Wi-Fi, guys. Nag-restart. Sana hindi na tayo mag-lag. Kagabi, mahaba din naman yung rush ako. Hindi naman kami nag-lag. Ewan ko, I don't know. Maybe it's the internet today. Mag-continue na ba tayo? Let's continue, guys. Okay, delete po ang boses niyo po. Kasi actually may mga students na taga dito sa amin, hindi sila nakapasok dahil mahina yung internet today. Dahil kahapon mahaba yung rush ako, hindi naman po, wait lang ha, may question. May question. Address ko muna yung question. If hypovolemic shock po ba, oxygen pa rin ang mauuna? Doon po sa question regarding cardiogenic shock. Yes po, unahin pa din po ang ating oxygen. Pangalawa po, mag-establish ka na ng IV line, mag-establish ka ng IV line for fluid reso. Dahil po, mas mabilis kang mag-hook ng O2 kaysa mag-hook ng IV line for fluid reso. At saka kung maaga ka po mag-deliver ng oxygen, dahil pag nag-hypovolemic siya po, wala pong delivery ng oxygen papunta sa cells. So to prevent hypoxia, magbibigay ka muna ng oxygen.
Ma'am, sadyang
and
hindi
then-
po kayo naka-share screen. Sis po, sorry po.
Opo, sir. Later po.
Okay po.
Ina-address ko po muna yung question ng isang estudyante na okay po ba yon? Yung after mo mag-hook ng oxygen to prevent hypoxia kasi dahil wala pong delivery ng blood, wala pong oxygen, mag-hypoxia. So to prevent hypoxia, mag-hook ka muna sa pasyente ng oxygen, and then after establishing yung oxygen doon sa patient, mag-establish ka na ng IV line for fluid reso to address shock. And ginagamit pa din po natin yung ABC of life. Okay po ba? Na-address po ba yung tanong? And mag-share screen na po ako. Anong number tayo ulit, guys? Uh, 24. Okay. Manitol, 23. Ang pinag-uusapan po natin kanina is therapeutic effect ng manitol. Eto. 23, di ba? Therapeutic effect ng manitol. So, ang sagot po natin doon is increased sensorium dahil po ang iyong manitol addresses cerebral edema. Pag nawala na po yung cerebral edema, nag-i-increase po ang sensorium. Kaya ang mismong therapeutic effect ng iyong manitol is increased sensorium sa pasyente. Number 24. In order to optimize cerebral perfusion pressure, and decrease ICP, the nurse know that she should position the patient in the following except. Head is kept in the midline position. Palagi natin ginagawa to. We should always keep the head in the midline position to prevent jugular vein distension. Prevent jugular vein distension. Dahil pag distended ang iyong jugular vein, mahihirapan bumalik ang dugo sa puso, magi-increase ang pressure sa ulo. Neutral ang body position, that is basically the same as A. So positive din to. Head elevation at 30 to 45 degree and less contraindicated is good. Ito po ay maglilasen ng iyong intracranial pressure by virtue of gravity. Ang mali po dito is letter B. Ito po yung exception. Bakit po? When the hip is flexed, tataas po ang intra-abdominal pressure. Anything that increases your intra-abdominal pressure cause increase in the intrathoracic pressure, and increase in both of these cause increase in intracranial pressure. So anything that hawakan ang tiyan, anything that increases ng intra-abdominal pressure, anything that increases your hawakan ng chest, nag-i-increase dyan, intrathoracic pressure, will increase intracranial pressure. So do not flex the hip. 24B. 25. When the nurse plans Ashton's case, the following but one negative prevents a rise in ICP. But one prevents a rise. Spacing activity is good. High fiber diet is good dahil mag-i-increase ang ating fecal volume, prevents constipation. Stool softener prevents straining. Prevent straining dahil po nagdi-deliver ka ng stool softener. High fiber diet prevent straining. Napakaayaw po natin ng straining. Dahil, bakit? Ano pong nangyayari pag nag-strain? Tumataas ang intra-abdominal pressure. Ang sabi ko kanina, pag tumaas ang intra-abdominal pressure, tataas ang intrathoracic pressure, tataas ang intracranial pressure. And valsalva maneuver is basically straining. Pag nag-strain, tataas, ito ang negative. Letter D, 25D. 26. Patient Maureen came to the ER with a complaint of general body weakness. Upon initial assessment, physicians suspected myasthenia gravis or MG, an ordered diagnostic test. Nasa neuro na po tayo. Topic, myasthenia gravis. MG is considered an autoimmune disease in which antibodies are directed against. Pag ang antibodies po directed against myelin sheath, ang involved po dito ay tinatawag nating multiple sclerosis and Guillain-Barré syndrome. Multiple sclerosis and Guillain-Barré syndrome pag antibodies directed against myelin sheath. Sa atin pong MG, saan po ba ang inaatake ng antibodies? Acetylcholine, the muscles, or yung receptor sites? Receptor po. Yes po. Tatandaan palagi na sa ating MG, wala pong decreased acetylcholine. Normal po ang production and level of acetylcholine. Ang nangyayari lang dyan is dinidestroy ng antibodies yung receptor sites. This is your muscle. Ito yung receptor sites. And instead of your acetylcholine being able to attach sa receptor site and be used by your muscles, hindi po sila nakaka-attach dahil dinidestroy po ng antibodies mo yung receptor sites. So antibodies are directed against acetylcholine receptor sites 26 dog. 27, the physician ordered for tensilon test. The nurse prepares which of the following medication sa bedside. Pag sinabi mong prepare at the patient bedside, anong pumapasok sa isip mo? Anong pumapasok sa isip mo? Antidote. 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 Pag sinasabing the nurse prepares which medication at the patient bedside, antidote. Bakit po? Pag nag-tensilon test ka, ang tensilon po or hydrophonium, it prevents breakdown of acetylcholine. So ang nangyayari, tumataas ang acetylcholine mo pag nagbibigay ka ng tensilon kasi it prevents breakdown of acetylcholine. So ang tendency po dyan, pwede kang magkaroon ng tinatawag na cholinergic crisis. Cholinergic crisis. Ano po ang antidote sa cholinergic crisis? Atropine sulfate. Bakit po ang atropine is anti-cholinergic? Anti-cholinergic. Number 27A, anti-cholinergic. Number 27. Hydrophonium chloride is the medication used to test for myasthenia gravis during a tensilon test. Hinihinga ka for me. The nurse knows that the medication works by... Masyado bang mabilis ngayon? Kasi may goal po tayong items, guys. May goal po. May goal po kasi tayo. Sakto lang po. Oo. Okay. Thank you. Number 28, hydrophonium chloride is the medication used to test MG during a tensilon test. The nurse knows that the medication works by... Anong ginagawa ng hydrophonium chloride? Increasing the production of neurotransmitter of acetylcholine. Hindi po, hindi naman kailangan patasin ang level dahil hindi naman po mababa. Promotes muscle strength and prevent muscle weakness. Hindi din po. Prevents antibodies from destroying acetylcholine. Hindi po natin kayang i-prevent ang antibodies, guys. Ang ginagawa niya po is stops acetylcholine breakdown dahil ito po ay anti-cholinesterase. 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 Pag nakikita natin yung ACE, ang meaning niyan breakdown. Pag sinabi natin cholinesterase, meaning breakdown niya yung choline. Pag sinabi natin anti-cholinesterase, ini-inhibit niya yung breakdown ng choline. Yan po ang ginagawa ng hydrophonium chloride. Nagets po ba yon? So basically, it stops acetylcholine breakdown, making it available for binding in the myoneural junction. So pinapataas niyo po yung level para mas madami po yung pwedeng mag-bind sa iyong receptor sites. 28B. 29. Descending paralysis is the clinical manifestation of myasthenia gravis. Descending paralysis. Meaning yung weakness nagmumula sa ulo, pababa. Descending paralysis. Yung ginagawa po namin para hindi makalimutan ganyan, myasthenia gravis. Ang arrow pababa, mula taas, pababa. Myasthenia gravis, descending paralysis. The majority of patients with MG exhibit which clinical signs? Ang BCND po ay ang triad ng iyong Parkinson's disease. Parkinson's disease, pill ruling tremors, bradykinesia, stoop posture. Yan po ang triad ng iyong Parkinson's disease. So, ang iyong sagot po dito is letter A. Diplopia, double vision, ang tinatawag po nating weakness in the levator palpebrae. Levator palpebrae, ito po yung muscle sa mata mo. Pag pumipikit ka, yung pumipikit na part, nandyan po yung muscle ng levator palpebrae. What we are basically referring here is ang tinatawag na ptosis, papikit-pikit ang pasyente. Ptosis, dahil nangihina po yung muscle na to, parang pumipikit yung pasyente. 29, clinical manifestation of MG is diplopia and ptosis. 30. Aspiration is one of the major risks posed by MG as it causes weakness in chewing and swallowing. Ang ginagamit po natin sa pagnguya at paglunok ay muscles. So kung may weakness po sa muscles ng paglunok at pagnguya, nasa risk po ng aspiration ang pasyente dahil hindi makanguya at hindi makalunok. What important patient education should the nurse emphasize? To maintain a liquid diet, kahit naman po liquid yan, pwede pa rin mag-cause ng aspiration yan. Sit upright when eating, kahit po naka-upright ang position mo, kung hindi ka din po nakakanguya at nakakalunok, pwede ka din pong ma-aspirate pa din. Rest after meals will not help the patient. We coincide the mealtime with the peak effect of the medication is the correct answer. Pag naka-peak effect po ang medication, mas malakas po ba ang muscles? Yes po. Mas nakakanguya at nakakalunok po ba ng maayos? Yes po. So we coincide the mealtime to the peak effect of medication 30C. 31. April, 36 years old, has been sent to the hospital for immediate burn treatment. Burn na po tayo. She suffered from fault thickness burn. Pag sinabing fault thickness burn, ito po ay third degree burn. Third degree burn. Over 40% of her upper body. Tanong, which of the following is the priority nursing diagnosis in patients with burns? Priority nursing diagnosis. Gamit tayo ng ABC, tanggal ang hypothermia, tanggal ang pain, fluid volume deficit, or ineffective airway clearance. Take note na patients mo with burn ay nagkakaroon ng, ay pwede po mag-suffer ng shock. Bakit po? Ang pasyente mo burn po ba ang skin, ang muscles, lalo na po pag third degree. So nagkakaroon po ng problema sa iyong capillary permeability, nagdi-decrease po. Ang nangyayari dyan, yung fluid po nag-i-escape from the blood vessels, pumupunta po sa interstitial spaces or third space. Kaya po ang makikita mong presenting symptom ng isang, nagkakaroon po ng fluid shifting dahil po sa decrease ang iyong capillary permeability. Nagkakaroon po ng fluid shifting, kaya ang presenting sign po sa iyong burn patient is nagkakaroon ng edema. Usually, generalized edema pa yan. So, answer of consideration, ang fluid volume deficit dahil at risk for shock ang pasyente. But, bakit po letter B ang sagot? Dahil letter B pa din po ang sagot. Bakit po? Dahil po, ang patient mo na galing sa sunog, nakaka-inhale po yan ng toxic substances. These toxic substances from the smoke impairs both airway and breathing. It impairs both airway and breathing. So, ipra-prioritize mo pa din na nursing diagnosis ang ineffective airway clearance. Dahil kahit po at risk for shock ang patient, priority mo pa din ang airway dahil mas madaling mamatay ang pasyente mo sa ineffective airway kesa sa shock. Address mo muna yung airway. When airway is cleared, you address fluid volume deficit. Palagi po natin na-apply ang ABC, guys. 31B. 32. The nurse knows that a patient who suffers from third-degree burn includes which of the following? Ang sunburn po, first degree lang to. Ang scald po, second degree. Ito po yung burn na nakukuha mo sa wet object or steam. Ang blister po, second degree lang po ito. Ang third degree po dito ay burn from electric current. 32C. 33. This is a method of determining how much surface area is burned by taking into account ang percentage of surface area represented ng anatomic parts that changes with growth. Scaring measurement, wala pong ganun, gawa-gawa lang to. Ang palm method po, ito po yung ginagamit nating i-estimate yung palm ng mismong pasyente to estimate the percentage of scattered burns. Pag scattered po, hiwa-hiwala yung burns, ginagamit po yung palm ng pasyente para sukatin yung laki ng burn. Ito naman pong rule of 9, ito po yung ginagamit natin yung estimation ng body surface area, tapos dinidivide po ng multiple of 9. Ito po yung pinaka-familiar tayo. Ang sagot po is letter A. Lund and Broder method is simply, ito po yung definition niya. We take into account percentage of surface body area represented by anatomic parts that changes with growth. 33A. 34. Full thickness burns causes severe damage to different layers of the skin na nagkakos ng increased capillary permeability. Ito po yung in-explain ko kanina. Meron tayong increased capillary permeability. So the nurse must watch out signs for, alam mo na, fluid volume deficit. Dahil increase ang capillary permeability, nagkakaroon ng fluid shifting from blood vessel papunta sa third space, presenting symptom edema, nagkakaroon ng fluid volume deficit sa iyong blood vessel and circulation. 34C. 35. Distributive shock is a fatal consequence. Dapat hindi po ito distributive shock. This is po dapat hypovolemic shock. Hypovolemic shock. Pero same pa din naman po yung question. Dapat po siya hypovolemic shock is a fatal consequence of serious burn kasi nga po nagkakaroon ng hypovolemia, di ba, dahil sa fluid shifting. The following are vital nursing intervention to prevent this from occurring, except negative ang hinahanap natin. Monitor VS and urine output early. Tama po ito. Document daily weight because your weight is your most ang weight ang yung best indicator and burn extremities to promote circulation back to the heart. Mali po ang small bore catheter. Kasi po pag mag-fluid reso ka, ang gusto po natin dyan, large bore catheter, gauge 18, or kahit yung mas malaki pa sa gauge 18. Ang tamang nursing intervention is large bore catheter, hindi small, for fluid resuscitation. 35C. 36. Fluid and electrolyte ball, nasa F and E na po tayo. Tapos na tayo sa burn, nasa F and E. Is vital to physiologic homeostasis. Nandito na ang sagot. Number 36. Nurse Sen reviewing the laboratory studies for a patient suspected of acute kidney injury. What test would be best indicator ng renal function? Palagi po, pag ang tinatanong indicator ng renal function, ang sagot po natin dyan is creatinine. Best indicator of renal function, 36B. Number 37. Ang sabi po sa akin ng ibang section, wala po yung options na to sa kanila. So, sasagutan na lang po natin. Number 37, a patient has been involved in a traumatic accident as in hemorrhaging from multiple sites. Nag-hemorrhage. The nurse expects the compensatory mechanism associated with hypovolemia would cause what clinical manifestation? So, nag-compensatory mechanism po ang katawan pag ang patient is nag-hypotension ba? Mali po, dapat hypotension. Hypotension po ang compensatory. Oliguria is a yes dahil ang kidney mo po ay your kidney is trying to retain fluid. So, oliguria, lumiliit ang ihi. Tachycardia, yes, your heart is trying to compensate. Pag nag-hypovolemia, nag-compensate ang heart, nagta-tachycardia. Kung tama ang tachycardia, automatic mali ang bradycardia. Tachypnea, yes. Pag meron po kasing hypovolemia, lesser ang oxygen delivery sa cell, your lungs will try increasing respiratory 2, 3, and 5. Nasaan yan? Letter D. 37D. 38. The nurse is caring for a patient with hypernatremia. What complication of hypernatremia should the nurse continuously monitor for? Hypernatremia, continuously monitor for. Anemia has nothing to do with hypernatremia. Polyuria, hindi po. Where sodium goes, water follow. So kung nag-hypernatremia, magkakaroon po ng fluid retention. Oliguria, hindi. Polyuria. Kidney injury is not. Pag sinabi kasing continuously monitor for, complication po ang inaasahan natin dito eh. Ang kidney injury po is hindi complication. Ito po ay more of a cause, not a complication of hypernatremia. Ang ating pong kailangan i-monitor is cerebral edema. Dahil po nagkakaroon ng water retention. Hypernatremia, where sodium goes, water follows. Pag na-retain ang sodium, retain ang water, risk for cerebral edema. 38C. 39. The healthcare provider prescribed a hypotonic IV solution. Hypotonic daw for a patient. Which IV solution should the nurse administer? Which of the following ang hypotonic? This is isotonic. D5LR is hypertonic. D5NSS is hypertonic. Ang hypo mo lang dito is A. Madaling tandaan yan kung anong hypotonic IV fluid. Anything that is below 0.9, katulad ng 0.45, mas mababa ba siya sa 0.9? Yes po. Anything below your 0.9 is your hypotonic IV solution. 39A. 40. A patient is admitted with severe vomiting for 24 hours as well as weakness and feeling exhausted. Nagsisevere vomiting siya, alkalosis, for 24 hours na daw. Na dehydrate na, kaya weak na at napapagod na. The nurse observes flat T wave and ST segment depression active in ECG. Nawindang ka ba sa part na to? May flat T wave daw at ST segment depression ng ECG. Anong sinasabi sa iyo niyan? Hypokalemia. Which potassium level? Yes po, hypocal guys. Which potassium level does the nurse observe when the laboratory studies are complete? So may idea ka na dito, nagsisevere vomiting. Nagsisevere vomiting. So madami kang nilalabas na potassium. Binigyan ka pa ng ECG reading. Kung magaling ka, alam mong hypokalemia. So anong in-expect mo sa laboratory finding? Alam mong hypokalemia pero hindi mo alam yung normal level. So ang normal level ng potassium mo is 3.5 to 5.5. Nasaan dito ang 40C? 2.0. 40 hypocal, letter C. Situation number 41. Menard, a 52-year-old male, was recently seen by the healthcare provider to confirm a diagnosis of gastric ulcer. He works at the construction site 6 days in a week. He presented himself to the doctor with complaints of abdominal pain. Number 41. Menard reports of experiencing pain during 1 hour post meals daw. His peptic ulcer disease, may dalawa po tayong classification of PUD, gastric ulcer, and duodenal ulcer. So ang patient po natin is may gastric ulcer. Which of the following is consistent sa diagnosis ng gastric ulcer? It is primarily related to stress, mali po. Sa duodenal po yan. Hypogastric pain, hindi din po. Ang pain po natin ay nafe-feel sa left side. Dahil nandun po ang stomach. Pain radiates to the left side of the abdomen where the stomach is for gastric ulcer, so hindi siya hypogastric pain. Patient reports blood in the stool. Blood in the stool or melena is for duodenal ulcer. Mali din po siya. So ang tamang sagot natin dito is letter D. Pain radiates to the left side of the abdomen. Nakikita po natin dito ang ratio dahil nandun po ang stomach na location ng iyong gastric ulcer. 41 is letter D. 42. The physician ordered metronidazole flagyl for the treatment of H. pylori. What instruction does the nurse emphasize to patient Menard? May metronidazole, treatment mo ng H. pylori. Ano ang kailangan mo nung i-emphasize sa pasyente? Take the medication with meals to decrease nausea. Hindi naman po ito nagkukos ng nausea. Educate patient regarding side effects. Maganda to. Avoid driving as medication may cause sedation. Hindi po nagkukos ng sedation, or letter B. Avoid alcohol when on flagyl therapy is the correct answer dahil po tinatawag nating disulfiram-like effect. Disulfiram-like effect. Ang disulfiram-like effect, ito po yung ginagamit natin sa aversion therapy. Kapag ang alcoholic patient po is we are trying to maintain sobriety of a patient na nag-aversion therapy na alcoholic, nagbibigay po ng disulfiram. And when the patient takes alcohol, nakaka-experience po siya ng mga adverse reaction. Nausea and vomiting, headache, yes, flu-like symptoms. Ganun din po ang nangyayari pag ang patient is under metronidazole flagyl therapy. Pag ang patient po nag-take ng alcohol, nagkakaroon din po siya ng disulfiram-like effect. So dapat po avoid alcohol. 42B. 43. Mr. Menard asked vendors regarding diet modification related to his recent diagnosed disease. The patient must limit which of the following. Ano po ang sagot sa number 43? Ang tanong pong ito ay nasa mismong board exam ko, number 100 NP3. Yes, kung alam mo ang sagot, may 1 point ka na kung itanong ulit. Milk, bakit po? Ang milk is alkaline. So pag uminom ka ng alkaline na milk, it will stimulate the stomach to increase the release of hydrochloric acid. Ang increase ng hydrochloric acid, in an attempt to neutralize yung milk, magpupos po ng rebound acidity, and it will cause pain to your patient. So we avoid foods that are alkalinic. Example is milk. 43 point. 44. The patient was scheduled for Bill-Roth 1. Procedure for ulcer management. What does the nurse understand will occur when this procedure is performed? Medyo napapagod kasi ako eh. Humihina talaga yung boses ko, guys. Ngayon, humihina talaga yung boses ko kasi napapagod ako. Ngayon po, are we good? Medyo nalalayo ka po sa mic. Yes po. Actually, humihina talaga yung boses ko. Hindi siya nalalayo sa mic, humihina. Lagi po. Lag po. How about now? Medyo okay na ba? Lag pa din ba? Clear na po. Lag pa din ba? Ma-full po voice nyo. Sana okay pa po kayo. Ilang gabi na po akong nagrarasyo, guys. Walang tulog kasi nag-night shift ako. Medyo pagod talaga. Okay na po ngayon. Magsasalita lang po ako in an average rate and sorry po. Okay na. Increase fluid intake. Walang magpapahinga. Okay, continue tayo. Okay na tayo sa number, tapusin na. Tapos na tayo sa number 43. Number 44. Opo, break sa 50, mga 5 minutes, no? Oo, break sa 50. Break tayo sa 50. Sanay kami sa OT, kalma. Hoy, hindi naman pwedeng walang rasyo-rasyo. Hindi pwede yun. Number 44, let's go. Ayun yun ang magrasyo. Sagot na lang. Answers key na lang. Hindi din pwede talaga. Pagagalitan ako ni Sir V. Paikliin mo yung rasyo. Paikliin po daw po yung rasyo. Resume na. Sorry. Okay, resume na. The patient was scheduled for Bilruth 1. Ganyan din ako dati. Sabi ko, wag nang magkwento. Wag naman namin sabi, resume na. The patient was scheduled for a Bilruth 1 procedure for ulcer management. What does the nurse understand will occur when this procedure is performed? Bilruth 1, dito tayo mag-focus sa A and B. Pag ginoin mo, Bilruth 1, huwag nyo na basahin lahat. Okay, sige, huwag daw basahin na lahat. Duodenum, okay. Duodenum, jejunum, ileum. Pag nag-Bilruth 1 ka, saan mo kinoconnect? Duodenum. Bilruth 1. Ganon? O, ganon. Mabilis, di ba? 45. A client was prescribed with Malox treatment for PUD. Which of the following statement best indicate the client understand how to correctly take this medication? Okay. I should take my medication before I take my other medication, no? At ang magsagot po dito is letter D. It is best for me to take my antacid 1 to 2 hour post-meal. Bakit po? Ito po ang peak 1 to 3 hour post-meal. Ito po ang peak secretion ng hydrochloric acid. So dito mo po ititake ang iyong Malox. 1 to 3 hour post-meal, peak secretion of gastric acid. Dito mo po ititake ang Malox 45D. Okay, SSD. SSD po. May mga nagagalit na po tayo dito. SSD na. Okay na po ba? Magna number 46. Active kayo pero mga ano kayo, magagalitin. Magagalitin kayo. Yung kagabi, yung ibang class ko, nung previous night, hindi sila ganun ka-participative pero mapapait sila. Okay, 45D. Irarasyo po natin yung tamang sagot. Situation number 46. Miss Min, a 25-year-old call center, admitted to the hospital. Ang chief complaint is abdominal distension and tenderness. She adds that she experiences crampy abdominal pain sa left lower part ng abdomen. Ang admitting diagnosis is diverticulitis. Ang admitting diagnosis is diverticulitis. Miss Min asked Nurse Kat what possibly could have caused the development of diverticulosis. Nurse Kat will focus the discussion on Miss Min's, ang sagot po, dietary intake. Bakit po? Bakit po? Bakit po dietary intake? Ano po ang cause ng iyong diverticulosis? Ang cause po ng iyong diverticulosis is low fiber diet. Low fiber diet. Pag low po ang fiber diet, mababa po ang fecal volume. Pag mababa po ang fecal volume, mahirap bang tumai? Yes po, mahirap tumai pag mababa ang fecal volume dahil po magpupush ka ng magpupush. Pag magpupush ng pagpupush, tataas po ang pressure sa lumen ng iyong colon. Tataas ang pressure sa large intestine. Ito po ang large intestine mo. Ito po yung lumen, yung loob ng large intestine. Pag mataas po ang pressure dyan, nagkukos po yan ng mga outpatchings sa loob ng iyong large intestine. Ito pong mga outpatchings na to, magkukos po ng obstruction. So instead na mailabas yung dumi, yung fecal matter, nai-stuck po sila dyan sa loob, nagkakaroon po ng bacterial growth and inflammation. So from diverticulosis, which are those outpatchings, pag nagkaroon na ng infection and inflammation, ang tawag na natin doon ay diverticulitis. So ang tinatanong po, ano ang cause? Dietary intake, low fiber diet. 46B. 47. The nurse instructed the patient how to lessen the pain during an acute episode of diverticulitis. So masakit daw. Kasi acute episode to ng diverticulitis, masakit na masakit to. The patient understands, ang hinahanap natin, positive, when she is stated, ambulating to promote gastric motility, promote bowel movement, prevent constipation. Isa lang po ang sinasabi nila, increased gastric motility. Increased gastric motility. Mali po silang lahat kasi isa lang naman po ang sinasabi nila. Ang goal po natin pag acute ang episode ng diverticulitis is to rest the bowel para ma-relieve yung pain. Rest the bowel. So magtitake ka ng anti-spasmodic and anticholinergic to rest the bowel. 47, dog. 48. The following are expected outcomes for Miss Main, except. Expected outcome kay Miss Main, attains a normal pattern, tama to. No pain and discomfort, tama to. Recovers without complication, tama to. Ayaw po natin ng daily intake ng bulk laxative dahil po ito ay pwedeng mag-cause ng damage or destruction sa nerve endings ng colon. Ayaw po natin to. Nagdi-delay intake po ng bulk laxative pag active pa po yung disease process pero after hindi na po tayo nagtitake. 48, dog. 49, Nurse Cat observes that patient Main is experiencing abdominal pain and has rigid board-like abdomen. Pag nakakita ka ng rigid board-like abdomen, alam mo na yan. Hindi mo na tinapos yung question. Has lost bowel sounds and symptoms of shock. Anong severe complication to? Peritonitis. Rigid board-like abdomen, pathognomonic sign ng iyong peritonitis. 50. The nurse is establishing a plan to promote good bowel habits for the patient. Promote good bowel habits for the patient. She will focus on sagot letter D. Establish a set time for meals and defecation with patient. Ano pong pinopromote natin dito? Muscle memory. Muscle memory. Ang pinopromote po natin, muscle memory. Pag meron ka pong established time na same time kang kumakain, same time kang tumatae, nasasanay po ang bowels mo, ang tawag dito muscle memory at nagpo-promote ito ng good bowel habits sa patient. 50, dog. Okay. Okay po ba tayo so far? Okay po ba tayo so far? Rest ka muna po. Yes po. Okay. Rest tayo 5 minutes lang guys ha. 5 minutes lang po. So may 1 hour na lang tayong natitira. Sana makatapos pa tayo ng 50 items para matapos yung NP4. 5 minutes, balik tayo sa 9:06.
Balik tayo, guys. Okay na ba? Balik po tayo. It's 9:07. G po. Situation, we are on number 51. Wait lang. We are on number situation number 51. Emily is a 36-year-old woman reporting continued emotional irritability. Presented with relative extremities, fat deposited in the face, neck, and abdomen. Complete physical exam, diagnosed ng Cushing syndrome. Cushing po ang topic. Which of the following clinical manifestation consistent with Emily's diagnosis should be most strictly monitored by the nurse? Lahat po ito nangyayari sa patient with Cushing syndrome. Ang Cushing mo po, Cushing, magpapatrophy tayo ng konti ha. Cushing syndrome. Sa Cushing po, taas po ang tinatawag na GMA, glucocorticoid, mineralocorticoid, and androgen. Yung glucocorticoid mo, ito po yung ma-manage na ating sugar level. Kaya po ang ating nakalagay dito sa glucocorticoid, S for sugar. Mineralocorticoid, S for salt. Ito po yung tinatawag natin 3S, androgen, sex. So, pag meron ka pong Cushing syndrome, dahil pag sinabi natin Cushing, taas lahat yan, taas ang sugar, taas ang salt, taas ang ating testosterone and estrogen. So kung taas ang sugar, meron bang hyperglycemia? Yes po. Pag taas po ba ang salt, meron po ba tayong hypernatremia? Yes po. At magkakaroon din po tayo ng hypertension dahil po pag may sodium retention, may fluid retention, increased fluid volume, nagkakaroon po ng hypertension. Nagkakaroon din po tayo ng hypokalemia. Bakit? Tulad ng sinabi ko kanina, magka-opposite po ang relationship ng inyong potassium, ng inyong sodium at ng potassium. So kung mayroon ka pong hypernatremia, matik may hypokalemia ka din. Pero ang tanong sa'yo, nasaan po ang most strictly monitored? Ano po? Sagot letter D, hypokalemia. SSD na po kayo ngayon. SSD na po, hypokalemia. Bakit po? Any disturbance in the level of potassium pwede pong mag-lead to cardiac arrest. Cardiac arrest. May it be hyperkalemia, may it be hypokalemia, any disturbance in the level of potassium may lead to cardiac arrest. So ito po yung babantayan mo among all these occurrences. Hypokalemia 51T. 52. The nurse encouraged Emily to verbalize her feelings. Sabi niya, I don't feel like me anymore with all the changes na nangyayari sa aking katawan. My friends say I look very much different. Ano ang appropriate diagnosis mo kay Emily? Disturbed body image. Bakit po? Nagkakaroon po ng buffalo hump ang patient, moon face, central obesity ang patient na may Cushing syndrome. So nagkakaroon po siya ng disturbed body image related to altered appearance because of Cushing syndrome. 52B. 53. The nurse knows that the following test will assist with the confirmation of the diagnosis of Cushing except blood, MRI and CT scan, yes po, they localize adrenal tissue at nagde-detect po sila ng mga tumors. CT scan and MRI is a yes. Ang exception po dito is blood typing. Kasali po ang plasma at urinary cortisol measurement dahil nagme-measure po kung masyadong mataas ang cortisol na nare-release ng iyong adrenal cortex. Blood typing is hindi kasali dahil hindi naman po hereditary ang iyong endocrine disorders. 53A. 54. A client with Cushing's
needs to modify dietary intake to control symptoms. The patient understands the instruction, understand positive regarding dietary modification when stated, I will increase my daily caloric intake. Hindi naman necessary to. Avoid salty and processed food is ang tamang sagot to control yung sinabi natin kanina, hypertension and hypernatremia. Dahil nga po mayroong sodium retention or tumataas ang sodium level sa iyong kasing. Number 54B, hindi mo po ililimit ang potassium dahil nga po nagkakaroon ng hypokalemia. So dapat maintain ang good potassium intake. 54B. Pacheck na lang po ang sarili nyo pag mali po sa G-form. 55, most cases of Cushing are due to pituitary tumor. Surgical removal ng tumor ang treatment of choice through transsphenoidal hypophyseectomy. Hypophysis ay pituitary gland. Pituitary gland ang hypophysis. Pag sinabing ectomy, removal of the pituitary gland. So ang hinahanap natin dito, ano po ba ang transsphenoidal? Ito po ang face, ito po ang ilong. Pag ilong po ito, pag transsphenoidal, dito po pinapasok yung instrument, tapos nire-remove po natin yung pituitary gland which is in the base of the brain. Yan po ang transsphenoidal hypophyseectomy. Ilong ito, dito pinapasok instrument, papunta po sa iyong pituitary gland. Ang tanong dito, which of the following activities would be a major focus when planning nursing care pagkatapos ng transsphenoidal hypophyseectomy? Hindi din to, cardiac arrest or CSF leak. Yes po, CSF leak ang tamang sagot. Ang CSF leak po ay expected in the first 72 hours. Pero after po 72 hours, dapat wala na pong CSF leak yan. Pag mag-leak pa din po after 72 hours, pwede pong magkaroon ng brain infection at ang air makaka-enter sa brain spaces. Monitor CSF leak 55C. 56. Charlene, 54-year-old, ay mayroong diagnosis ng diabetic ketoacidosis, DKA. Non-adherent siya sa kanyang dietary and medication regimen. She has had several admission. On admission, she is drowsy and responsive. Number 56, tanong, which of the following are true about DKA except? So, negative ang hinahanap natin. 1, tama po ito, DKA is common sa type 1. May mga case na rin po na may DKA ang type 2, pero ito po ay common complication ng type 1. C, tama po ito because of acid build-up, nagkakaroon ng acetone breath. Life-threatening po ang DKA, nakokoma at hindi po natatagal, may mga pasyenteng namamatay kaagad after makoma. Ang correct answer po dito, exception is letter B. Tama po na nagkakaroon ng ketone build-up, pero mali po ang protein metabolism, dapat fat metabolism. Ang ketones po ay end product ng fat metabolism, hindi ketone. 56B. 57. Still dehydration occurs in a patient na may polyuria. Dahil ihi, nagkakaroon ng cell dehydration. What rehydrating IV solution that nurse instruct to infuse has a history of hypertension and congestion? DKA is lifelong. Hypertension and congestive heart failure. So normally po, ang ating pang-fluid reso, pag nagkakaroon tayo ng, ang ating pang-fluid reso, pag mayroong cell dehydration ay tonic lang, di ba? Pero pag mayroon po tayong hypertension, history of hypertension and congestive heart failure, hindi na po natin IV fluid of choice ang isotonic dahil po mataas ang kanyang sodium level. Ang 0.9 po dito is sodium level po ang tinutukoy nito. Pag mayroon pong history of hypertension, ang choice po natin is hypotonic fluid. Bakit po? Bakit hypotonic? Mas mababa po kasi ang sodium level, 0.45 lang. Pag mayroong history of hypertension, to prevent complications. Dahil pag mataas ang sodium level, magkakaroon ng water retention and may aggravate hypertension of the patient. 57, hypotonic po, C. 58. What laboratory results will the nurse expect to find that may be associated with Charlene's condition? Si Charlene po ay may DKA, hindi po ba? So automatic eliminate ang hypoglycemia dahil hyperglycemia po yan. Hypocal or hypercal? Hypercal po. Ganito po ang nangyayari. Hypercal, tama. Baka nyo alam. Alam nyo na to? Ang potassium po is the major cation present inside the cell. Pero pag concentrated po ang glucose sa dugo, lumalabas po ang potassium mo, nakikipag-osyosahan po siya sa madaming glucose. Anong meron? Bakit madami kayo dyan? Sabi niya, lumalabas po siya, galing sa cell, pumupunta siya sa dugo. Kaya nagkakaroon ng hypercalcemia. The good thing about that is pag nag-deliver ka na ng oxygen, ng insulin, may insulin ka na dito, binigay mo na, yung glucose mo pumasok na sa cell, pumapasok na din po yung potassium. Kaya together with hyperglycemia and hyperkalemia, nako-correct po ito ng insulin. Number 58 is letter B. Number 59. The nurse is administering insulin drip. Pag sinabing insulin drip, via IV to. What exogenous insulin does the nurse know as the only one that can be delivered via IV? Isa lang po ang insulin na kaya na pwede nating ibigay via IV. Tamang sagot, regular. Wala na pong iba. 60. Patient Charlene became overly concerned with the current pattern of her breathing. The nurse recognized this as Cosmos respiration and informs Charlene that bakit nagko-cosmos ang pasyente mo na may DKA. Ito po ay compensatory mechanism in response to DKA. Letter C. Pag DKA po, nagkakaroon po tayo ng metabolic acidosis dahil po sa ketone build-up. Fat metabolism, ketone build-up, ketones are acids, nagkakaroon ng metabolic acidosis. Pag metabolic acidosis, ang compensatory mechanism is palaging respiratory. So in an attempt na ilabas yung acid sa katawan, binibilisan po ang paghinga. Nagha-hyperventilate. Compensatory mechanism, 60 is letter C. Situation. So far, are we good? Situation for number 61. Martini, 24-year-old, sexually active siya for 5 years. She experienced incidences of cervicitis po. She is now diagnosed in physician with PID, pelvic inflammatory disease. The nurse assesses patient Martinez history for possible causes that lead to the development of PID. Ano po ang mga possible causes ng PID? Except negative ang hinahanap natin. Ang pinag-uusapan po natin dito ay reproductive disorder. Insertion of intrauterine device pwede, multiple sex partners pwede, frequent vaginal douching pwede. Ang hindi po kasali exception is UTI dahil ito po ay urinary. Ang pinag-usapan po natin dito ay reproductive. 61D. 62. Okay, baka may SSD. 123, 123 SSD. Kasi baka pagalitan na naman ako. 62. Patient complains of severe lower abdominal pelvic pain. Ano ang comfort measures na pwede nating ibigay? Anong comfort measure na pwede nating ibigay? Apply heat safely to the abdomen and administer analgesic at prescribed. Pwede. Encourage patient to increase mobility. Hindi po sila makakapag-address ng pain. Apply heat ang tama at administer analgesic as prescribed. 62A. Mag-ano ko na. Yan, 63. What is the priority nursing diagnosis pag may PID? Pag naghahanap tayo ng priority nursing diagnosis, priority natin ang actual is greater than risk. So tanggalin na natin yung mga risk, hindi natin priority natin actual. So actual na po ang C and D. Pero priority natin ang physio over psycho. Psycho to, eliminate, physio to, actual and physio, letter C, number 63. Ganun lang po mag-eliminate. Nakuha po ba ang part na yon? Actual over risk, physio over psycho. 63C. 64. Upon laboratory works and ultrasound, it was seen that the infection has progressed. And involved na ang uterus, involved na ang fallopian tube, involved na ang ovaries. So mag-surgical intervention na required para sa pasyente. What type of surgery does the nurse expect for the patient? Ang sagot po, hysterectomy with bilateral salpingo o oophorectomy. Ano po ito? Ito po ang removal ng uterus at and tinatanggal din po yung fallopian tube at ovaries. Ito po yung salpingo o oophorectomy. Both the fallopian tube and both the ovaries. Bakit po? Dahil affected na po silang lahat. Kailangan po silang tanggalin lahat to prevent metastasis. 64B. Tabso. Tama po. Ito po yung tabso. 65. Patient education was conducted for Martini before discharge. Education has been effective if the patient states the following except. Negative ang hinahanap natin. I will maintain good perineal hygiene. Tama. Immediately report the physician pag may recurrence ng symptoms. Tama. Encourage my sex partner to be examined. Tama po. Ang mali, avoid tampons and intercourse for at least 3 weeks. Matagal po ang 3 weeks. 1 week lang. 1 week. Number 65A. 66. Rain, a 24-year-old private company employee, mayroon siyang oval-shaped ulcer with firm border sa kanyang genitalia. Oval-shaped ulcer and firm border sa kanyang genitalia. Sexually active siya for the past 3 years. And yung ulcer po is present more than 2 weeks na, pero walang pain and discomfort. Number 66. After conducting history and physical assessment, the physician orders diagnostic test ng confirmation for syphilis. Which of the following is not an appropriate test in relation to the primary diagnosis? Ganun yung gagawin nyo ha. Pag nakakabasa kayo ng mga keyword na not, except, understanding, mag-positive, negative na kayo guys para hindi kayo mawala. Dark field exam, maganda po to. Ito po yung nabibigay ng immediate diagnosis. VDRL, ito po yung nagdi-detect ng non-specific antibodies. FDA, ito po yung nag-identify ng mismong antigen ng T. pallidum, which is the causative agent ng syphilis. Ang hindi po kasal is ELISA, letter C. Alam mo naman ang ELISA ay presumptive test for HIV. So nung nabasa mo na not appropriate for syphilis, alam mo na ito yung sagot. Number 66C. Yes po, para po siya sa HIV. Number 67, the causative organism for syphilis is Spirochete treponema pallidum. The patient asked the nurse how she could have gotten infected. Bakit po ako nagkaroon nito? With this organism, what explanation should the nurse provide to the patient? Hindi po siya natatransfer by saliva during kissing. And ang syphilis po, hindi po siya complication ng HIV. Rather, it is a cofactor in the development of HIV. Co-factor po siya, hindi po siya complication. Congenital infection po, tama po ito, pero sa case ng pasyente, hindi naman po via transplacental ang contraction niya kasi hindi naman siya newborn. Ang tamang sagot is letter C. Nasa-transfer ito pag active, mayroong lesion sa primary and secondary syphilis is present. 67C. Number 68, after a series of antibiotic testing, Rain have been found to have allergic siya sa penicillin and sa drug class ng penicillin. Ano ang ini-expect mo na alternative pharmacologic management? Ang ceftriaxone po ang doxycycline para po ito sa gonorrhea. Ang yun naman po ang probenicid is binibigay po ito kasama ng penicillin para ma-slow down ang excretion. So hindi po ito. Hindi po antiretroviral dahil po ang iyong T. pallidum is a bacteria, hindi virus. Ang tamang sagot, doxycycline or tetracycline. Ito po ang ating drug of choice sa mga non-pregnant client na allergic sa penicillin. Letter B for number 68, boy. 69. In syphilis, the period after infection with T. pallidum in a patient is seroactive siya, seroactive, pero walang evidence ng disease. No other evidence of the disease is known in what stage. Ang tawag natin dyan, latent. Pag sinabi natin latent, inactive. Positive siya sa mga serum test pero walang magmamanifest na signs and symptoms. Inactive, ang tawag natin dyan, latent stage 69C. 70. Rain is in the primary stage of syphilis infection and is under antibiotic therapy. What important instruction must the nurse emphasize to the patient? Nasa primary stage ng syphilis under antibiotic therapy. Tamang sagot, letter D. Instruct the client to abstain from sexual contact for at least 1 month after treatment. Ito lang po ang option mo dito that has something to do with the antibiotic therapy. Your A, B, and C, hindi po, it has nothing to do with antibiotic therapy. Hygiene to, inform to, hindi to instruction. Instruction to, but has nothing to do with antibiotic therapy. 70, D. 71. Situation, Kevin is a 32-year-old on a skate trip with his office mates. While skiing, he fell and nagsustain siya ng mga fracture sa left forearm niya at may swelling. Nirescue siya and dinala sa nearest hospital. 71. When Kevin arrives in the emergency department, how does the nurse expect the patient to describe the pain? Pag nagdi-describe po tayo ng pain caused by fracture, ang description po ng pain is sharp and piercing. Ang description po ng pain for fracture is sharp and piercing. Number 71B. Number 72, the patient sustained an open fracture. Open ang fracture. What emergency management of this fracture involved? Irarap ba? Hindi po, ini-immobilize natin yan. Have the client patient immobilize? No, immobilize po. Put in a neutral position or cover? In neutral position or i-cover? Cover po, kasi this is an open fracture. To prevent the most serious complication ng iyong open fracture, this is related to the next question. So, ang emergency management mo pag open fracture, i-cover mo kaagad. Letter dog. Number 73. Oops. Wait. 73. The nurse is caring for patient Kevin recognizes that ito na po yung sinasabi natin na most serious complication of an open fracture. Ano po ito? Hindi po seryoso naman ang iyong muscle atrophy, ang iyong necrosis, hindi po. Nerve damage, ang tinutukoy po dito ay yung peroneal nerve injury na nagkakos ng foot drop. Hindi naman po ito life-threatening, hindi po siya ang most serious complication. Ang most serious complication po dito, tama, letter C, infection. Ito po yung tinatawag nating osteomyelitis. Osteomyelitis is the infection of the bone. Pag mayroong open fracture, open ng skin, open ng muscle, pwede pong pumasok ang mga pathogen directly sa bone. Pag nagkaroon ng infection sa bone, pwede po itong mag-lead to septicemia and septic shock, life-threatening. Number 73C. 74. Pagkatapos i-close ang open fracture, the orthopedic surgeon applied plaster of Paris. Ang plaster of Paris po, ito po ay isang bandage or cast na para lang po siyang normal na bandage pero binabasa po siya ng water tapos pag tumitigas siya, nagiging semento po siya. So sa left forearm ng pasyente to promote immobilization and healing. The nurse educate client regarding the cast and determines teaching had been effective when the patient is stated the following except. Negative po ang hinahanap natin ulit, except. I must constantly observe hotspots. Tama po ito. Ito po ay mga signs of infection, positive. I must not facilitate drying using aircon due to possibility of moisturing. Yes po, ayaw po natin ng moisturing dahil moisturing encourage bacterial growth, positive. Plaster, I may expose the cast using dry hair dryer as long as it is in the college setting. Tama po ba ang letter B? Yes po, pwede po tayong gumamit ng hair dryer as long as it is in the coolest setting. Hindi lang po tayo pwede gumamit ng hair drying pag ipuput po natin sa warmest setting dahil nagtra-transfer po ang heat. Pagkatapos mo po mag-hair dryer, transfer po yung heat sa cast. Pagkatanggal mo po ng hair dryer, sobrang init na yung cast. So, pwede pong gumamit ng hair dryer basta nasa coolest setting. Tama po ito. Ang exception po natin, negative letter A. Plaster of Paris may dry in 10 to 15 minutes. Hindi po. 48 hours po bago mag-dry ang plaster of Paris. allow me to have weight-bearing activity in 30 minutes after cast is applied. This statement is true for fiberglass cast, hindi po sa plaster of Paris cast. Pero sobrang mahal po ng iyong fiberglass cast. 74A. 75. One of the complications posed by casting is compartment syndrome. Familiar na po ba sa compartment syndrome? When the cast have been applied tightly, the nurse suspects compartment syndrome, which of the following is assessed. Compartment syndrome po, ito po yung napaka-tight po ng cast, tapos nawawalan po ng blood flow sa distal area from the cast. Plus 2 ang peripheral forces sa affected area. Gusto natin to. Ito po ay normal. Capillary lever less than 3 seconds. Gusto po natin to. Dahil pag greater than or mas mataas na, more than 3 seconds, yun po ay nagsasabi na inadequate na ang blood flow. Warm area distal to the casted extremity. Tama po ito. Masama na po, compartment syndrome na po kung cold. Magsususpect po tayo ng compartment syndrome pag nag-report na po ng numbness. Numbness is one of the earliest manifestation of compartment syndrome. Nagnanumb na po dahil hindi na po adequate ang blood flow. Sign of compartment syndrome. 75C. 76. Joyce, 32 years old, visited the clinic. She reports early onset symptoms of RA, rheumatoid arthritis, which were the following with the nurse most likely to assess inpatient Joyce. Unilateral po ba sa RA? Hindi po. Bilateral po sa RA dahil symmetrical and systemic. Ano yung 5 type of error? Pain relieved by rest is for OA. Pain relieved by rest is for OA, hindi for RA. Stiffness in the morning po ang consistent sa iyong rheumatoid arthritis. Bakit po? Pag natutulog ang pasyente, yung mga inflammatory chemicals, naiipon po sila sa synovial fluid. Pagkakagising po ng pasyente sa umaga, nakakaramdam po siya ng stiffening na may pain. Number 76B. 77. Joyce expressed that she has been experiencing excessive dryness of the eyes, mouth, and vagina. This is a symptom of rheumatoid arthritis. Nakakaroon ng excessive dryness. The nurse recognizes this clinical manifestation as, ano pong tawag natin dito? Ang tawag po natin dito ay Sjogren's syndrome. Ang Heberdin's po, ito po ay para sa OA. Ito po yung finger mo, and then may joint ka dito, Heberdin's Bouchard's. May mga bony overgrowth sa proximal joint ng finger. Heberdin's Bouchard, pero this is for osteoarthritis, hindi po siya pang OA. Swan's neck is finger deformity. Philtis syndrome, ito po yung may leukopenia and splenomegaly. So for dryness, ito po ay Sjogren's syndrome, 77 dog. To combat the inflammatory process na nangyayari sa RA. The following are instructions to be emphasized sa patient during steroid therapy, except negative po ang hinahanap natin. Take medication immediately after meal. Opo, kailangan full stomach dahil nagkukos po ito ng GI irritation. Monitor daily weight. Tama po ito dahil ang steroid ay nagkukos ng water retention. So, monitor daily weight. Avoid crowded places dahil ang iyo pong steroid ay immunosuppressant. So, decrease po ang immune system, avoid crowded places. Ang mali po dito ay increase fluid and sodium intake. Dahil nga po nagkukos ng water retention ang steroid sa katawan, huwag ka nang mag-increase ng fluid and sodium intake. Number 78, dog. SSD, go. Number 79. Which of the following is the priority in nursing intervention for Joyce during acute exacerbation of RA? Pag acute exacerbation, nangiisip po natin dyan, pag nakikita niyo po yung mga acute episode, acute exacerbation, ang meaning po niyan, masakit, painful. Ang goal mo dyan, comfort. Yan ang palagi mong isipin, ha? Pag nakakakita ka ng acute exacerbation, acute episode, painful, yan sa pasyente. Ang goal mo, ang hanapin mo dyan sa option, ano ba ang nagpro-promote ng comfort? Well-balanced diet, hindi yan. Passive ROM, sobrang sakit, huwag kang mag-ROM ngayon. Apply warm and cold compress alternatively, hindi po yan ang ating priority. Second priority po siya. To promote comfort, bed rest po tayo during pain kasi sobrang sakit po yan. And also, this is for the purpose of safety. Kasi if the patient is in pain, huwag po nating pagpalakad-lakarin dahil para ma-prevent po ang mga pathologic fracture. 79A. 80. When preparing the teaching plan for a client about crutch walking using 2-point gait, ang hahanapin mo, which of the following would the nurse include? Kung hindi pa po kayo familiar sa mga gait pattern, ang suggestion ko po is manood kayo sa YouTube. Kasi nung binabasa ko po to, nalihirapan din ako at nalilito. Pero isang beses lang akong nanood sa YouTube ng tutorial, ang dali-dali niya lang matandaan. Pag nakita mo na yung demonstration, madali na po siyang matandaan. Panoorin niyo na lang po sa YouTube yung mga gait pattern. So for 2-point gait, ang tamang sagot po dito is letter B. Ang letter A po ay 4-point. Ina-advance mo yung opposite foot and then ina-advance mo yung crutch and then yung foot and then yung crutch and then yung foot. 4-point po yun. Hindi to po sa crutch on one side and then simultaneously together with the same foot, magkasama po silang nag-a-advance. Magkasama. So 2-point gait lang po ito. Ito pong hinahanap natin, letter B. Pag sinabi nating lifting both lower extremities to the level, ito po ang tinatawag nating swing to. Swing to gait. Pag to the level of the scratches. Pag sinabi namang past the level of the scratches, past the level, swing through. Swing through. So ang 2-point gait po is letter B, 80B. Pag mali sa G-form, paki-correct na lang po ang sarili. Situation, the blood is the most vital. Nasa blood disorders na po tayo. A patient with end-stage kidney disease, ESKD, has developed anemia. What laboratory findings did the nurse understand to be significant in this stage of kidney disease? Pag kidney po ang pinag-uusapan natin, alam na po natin yan, CREA. Most significant indicator of kidney function, CREA. Tapos kung titingnan po natin dito, normal po ang potassium 5.2, normal ang magnesium mo 1.5 to 2.5 ang normal. Ang normal 3.5 to 5.5. Ang normal lang calcium is 8.5 to 10. So lahat po sila nasa within normal level. Ang significant po dito is CREA kasi sobrang taas. Ang CREA mo po 0.6 to 1.2 lang. Yung 6 mgdl sobrang taas. 81 dog. 82. The nurse is performing an assessment for a client with anemia admitted to the hospital. Why would the nurse need to include a nutritional assessment for this patient? Bakit ka nagno-nutritional assessment sa patient na may anemia? Required lang? Important? Hindi? Para alam mo kung anong kakainin ng pasyente? It may indicate deficiencies in essential nutrients or determine what type of anemia. Hindi naman po agad-agad magde-determine ng type of anemia. Ang makakapag-determine po ng type of anemia is laboratory and diagnostic exam. So ang dito lang po, ang purpose lang po ng nutritional assessment mo is to determine deficiencies. Kasi pwede po ito mag-suggest ng folic acid ba, deficiency, or iron deficiency, ganun po. Suggestion lang po ng deficiencies in essential nutrients, 82, boy. 83. The nurse is preparing a patient for a bone marrow aspiration and biopsy from the site of posterior iliac crest. Posterior iliac crest, ito po siya. Posterior superior iliac crest. Ang tanong sa iyo, anong position? Sabi po natin kanina, pag concept ng positioning, ang goal mo is to expose the operative site. So kung ito po ang operative site, nandito sa gilid, ang position of choice mo is lateral. Tatagilid ka with one leg flex para accessible ang operative side mo dito. Jackknife is knee chest, lithotomy no, supine no. 83C. 84. Which of the following is the priority nursing diagnosis for a patient with anemia? Priority nursing diagnosis. ABC. Nakakita ka ng word na priority. May airway ba concern? Wala. May breathing concern ba? Wala. May circulatory concern ba? Meron po. Ineffective tissue perfusion. Hindi mo priority itong dalawa. Imbalanced nutrition is also an important concern, pero dahil meron kang circulatory concern dito, ineffective tissue perfusion, dahil inadequate ang blood volume or hematocrit, ang priority mo is letter C. 84C. The nurse and the client collaborated and discussed on how to avoid and manage fatigue. The planning has been effective. When at the end of the discussion, the patient is stated, increase activities para mag-increase ang heart rate, hindi. Implement safety to measure and prevent injury, hindi po siya nag-a-address ng fatigue. I will limit my alcohol intake, hindi din po ito nag-manage ng fatigue. Prioritization of activities, mag-establish ng balance ng activity and rest is your answer to avoid and manage fatigue. 85, boy. 86. Si Julie, 71-year-old, naka-experience siya ng fatigue, irritability, and weakness. The nurse observed paleness in the skin. Nagkaroon siya ng total gastrectomy 2 years ago. Napaka-importante po, ito po ay keyword, total gastrectomy 2 years ago. Taking into consideration the patient's symptoms and health history, what type of anemia that the nurse expects for patient Julie to have? Hindi po iron deficiency, hindi po folate acid. Dahil ang iron deficiency and folate acid is deficiency lang po ng intake ng iron and folate. Ano po ang iyong aplastic? Aplastic po, ito po yung nagkakaroon ng decrease or damage sa mga marrow stem cells ng bone marrow, tapos na-replace po sila ng fat. Dahil na-replace po ng fat, nagkakaroon po ng decreased hematopoiesis or production of red blood cells. Kaya nagre-result po siya sa anemia. Ang tamang sagot po dito is pernicious. Dahil ang patient po is nagkaroon ng total gastrectomy. Ano po ba ang pernicious anemia? Pernicious anemia is caused by decreased intrinsic factor. Intrinsic factor sa iyong GI. Yes po, lack of intrinsic factor. Ang intrinsic factor po is kailangan po ito para sa absorption ng iyong vitamin B12. Pero dahil po wala kang intrinsic factor, wala kang absorption ng vitamin B12, nagkakaroon ka po ng tinatawag ng pernicious anemia. Iba po ang vitamin B12 deficiency anemia lang, dahil yun po ay lack lang ng mismong vitamin B12, ang pernicious anemia mo po ay mismong lack ng intrinsic factor. Na kahit gaano po kadaming vitamin B12 ang itik mo, hindi pa din po siya ma-absorb dahil walang intrinsic factor. So for a patient na nagkaroon ng total gastrectomy, hindi po adequate or walang production ng intrinsic factor dahil ito po ay naproproduce sa inyong GI tract. So ito po ang may pwedeng mag-lead sa pernicious anemia. 86, jog. 87, the physician ordered test for the confirmation of the diagnosis. The test involved an administration of a small amount ng radioactive B12 and may 24-hour collection. Ano po ang tawag natin sa test na ito? Schelling's test. Nag-i-intake ang pasyente ng radioactive vitamin B12 at nag-collect po siya ng 24-hour urine collection para ma-monitor kung nare-release po ba yung vitamin B12. Ito po ang Schelling's test. 87, boy, tama. 88, while the nurse was conducting physical assessment, patient Julie asked the nurse why her tongue looks redder than usual. Sabi niya, bakit ang pula? Bakit ang pula? The nurse gives correct explanation to the patient by, tamang sagot, anong pathognomonic sign ng pernicious anemia mo? Pathic side, pernicious anemia. Beefy red tongue. Beefy red tongue. Ang strawberry red tongue ay saan? Scarlet fever. Scarlet fever. Scarlet po, hindi po Kawasaki. Strawberry red tongue is for scarlet fever. Beefy red tongue is for pernicious anemia. 88, boy. Pharmacologic treatment is vital in management of pernicious anemia. The nurse knows that the physician will prescribe meron kang pharmacologic management. Daily oral supplementation of vitamin B12, hindi po. Dahil kahit gaano pa kadaming intake mong vitamin B12, hindi yan ma-absorb dahil walang intrinsic factor. Hindi din po makakatulong ang rich food. B or C? B or C? Tama, letter B. Monthly parenteral administration of vitamin B12 iron for life. Wala pong transfusion of intrinsic factor. Ang intrinsic factor na produce lang po yan sa intestinal tract. Walang transfusion of intrinsic factor. Mali po yan. 89 boy. 90. Okay, so na makakatapos tayo ng hanggang 100. People with pernicious anemia have a higher incidence of gastric cancer than the general public. Mataas ang incidence ng gastric cancer. The nurse must stress the importance of letter D, ongoing stool exam and gastric cytology. Ang tawag po natin dito is secondary prevention. Secondary prevention. Ito po yung secondary prevention. Familiar po kayo, di ba, sa HN, wherein ang pasyente mo is at risk and nagkakaroon siya ng continuous monitoring sa kanyang sarili to prevent the disease. Ongoing stool exam and gastric cytology must be stressed to the patient. 90, dog. Anyone? Gina is a 15-year-old high school student. She is being sent sa emergency department dahil meron siyang uncontrolled epistaxis, nagno-nosebleed. During transport, Gina from the school to the hospital, the school nurse gives the following instruction to control bleeding except. Negative ang hinahanap natin. Gina must sit upright, tama to. Head should be tilted forward, tama to. Applied cold compress to the ice pack, tama to. Vasoconstriction will decrease bleeding. Ang mali po is letter C. Tama po na ipipinch yung soft outer portion, pero mali po yung 3 to 5 minutes. Dapat po 5 to 10 minutes. Number 91, C. What is the priority nursing management upon arrival of the patient to the emergency department? Dumating na ang pasyente sa emergency room. Ano ang priority nursing management mo? Kasi magiging ER nurse ka. A. Monitor vital signs and assess in control bleeding. Mag-provide ng tissue at Mrs. Basin. I-reassure hindi. Maintain a calm. Hindi po. I-assess mo kaagad ang vital signs dahil po uncontrolled bleeding. Tulungan mo na kaagad yung pasyente para hindi ka magkaroon ng hypovolemia. 92A. 93. The parents of Julie reported to the physician na ang nose bleeding niya daw is recurrent and had been recurring for the past year. The physician ordered lab works and diagnostic because recurrence may indicate hindi neuro problem, hindi immunologic, hindi infection. Cancer po. Letter B, boy. Pag recurrent po ang nose bleeding, it may suggest cancer. Number 94. The physician inserted a nasal packing with neosinephrine. Ang neosinephrine po ay vasoconstrictor na nag-i-stop ng bleeding. Sabi ni Julie, she became concerned with how she looks with the nasal packing and felt bad about going back to school. Paano i-reassure ng nurse si Julie? Ang sagot po, letter C. The nasal packing will remain in place as necessary lang. Hindi po ito mag-i-exceed ng 6 days. Pag sinabi mong non-therapeutic po ang D, mali po ang B, mali din po ang E. Hindi po yan permanent. Temporary lang po yan. Number 94, C. 95. The nurse educates Julie on how to prevent future episodes of bleeding. Patient education proved to be ineffective. Negative, when Julie is stated, I must avoid straining in stool, tama po to, para hindi increase in pressure pag nag-straining will cause bleeding. I will prevent myself from picking my nose to avoid injury. Forceful nose blowing is avoided 2 days post-removal, tama po ito, to avoid bleeding. I will keep my nasal passages. Bakit po? Pag dry po ang mucous membrane, ito po ay prone to trauma. Dapat po mayroong adequate humidification to avoid trauma. 95A. 96. Situation. Carmina, 37 years old. She is recovering from multiple fractures from a car accident. She was sent to the hospital kasi naka-experience siya ng shortness of breath. And she was later admitted sa ICU dahil po mayroon pala siyang pulmonary embolism. Question, Carmina asked the nurse what could have caused. Bakit po ako nagkaganito? Sabi ni Carmina. She was getting better from the accident and had plenty of rest. The nurse recognized the following contributing factors in the development of pulmonary embolism except negative. Contributing factor po ba ang multiple fracture? Yes po. Ang fats mo, fat accounts 70% ng iyong adult bone marrow. So kung nagkaroon pa po ng multiple fracture, ang fat po ay pwedeng lumabas galing sa bone at dahil po semi-permeable ang iyong capillary blood vessels, pwede pong pumasok ang fat, makapasok sa circulation at mag-cause ng fat embolism. Ang orthopedic surgery naman po is also a contributing factor dahil po nagkakaroon ng hypercoagulability. Kaya po before orthopedic surgery, nagbibigay po ng mga anticoagulant para po surgery yung mga hypercoagulability ay hindi mag-cause ng embolism. Immobility is a yes dahil po sa venous stasis. Pag mayroong venous stasis, nagkakaroon ng thrombus formation. Pag na-dislodge yung thrombus, nagiging emboli, pwedeng mag-cause ng pulmonary embolism. Ang hindi po kasama, ASA. Ang ASA po ay mayroong anti-platelet property. Therefore, it prevents clotting. So, hindi po siya magkukos ng pulmonary embolism. 96, jog. 97, what symptom does Carmina exhibit that most commonly occurs in the presence of pulmonary embolism? Makinig po sa part na to. Tanggalin natin ang cyanosis and dyspnea dahil po ang pinag-uusapan natin dito is pulmonary. So, focus tayo sa dyspnea and tachypnea. Eliminated na po yung cyanosis and restlessness. Ang tinatanong po sa iyo, symptom. Pag sinabi po ba nating symptom, objective or subjective? Symptom, objective or subjective? Pag symptom po, yan po ay subjective. Yes po. Ang dyspnea po is defined as difficulty breathing. Sino po ba ang nagsasabi na nahihirapan siyang huminga? Ang pasyente. Sabi ng pasyente, nahihirapan siyang huminga. Therefore, dyspnea is a subjective data. Ang tachypnea po is determined via counting the RR. Sino ang nagdedetermine na tachypnic ang patient? Ang nurse. Via what? Via counting the RR. So, tachypnea is an objective data. Kung subjective to, ito ay symptom. Kung objective to, ito ay sign. Ang tinatanong sa iyo dito, symptom that most commonly occurs in the presence of pulmonary embolism. Therefore, ang sagot mo dapat dyspnea. Parehas kasi silang most commonly occur. Babantayan mo lang kung ang tinatanong sa iyo is symptom or sign, subjective or objective. Number 97, dyspnea, B. 98. What is the priority nursing goal in the management of patient with pulmonary embolism? Ano ang priority nursing goal mo? Priority, nakakita ka ng priority, lagay ka agad ng ABC. Hindi mo, hindi to, hindi tinto. Adequate oxygenation, breathing, jog. 98, jog, breathing. 99, the patient was put in anticoagulant therapy. The following nursing interventions are vital in caring for patients in anticoagulation therapy except naka-anticoagulant po yung pasyente mo. The following nursing are vital in caring for the except negative po ang hinahanap natin. Observe color in stool. Bakit po? Kasi pag nag-anticoagulant, pwede mag-bleeding. Bamantayan mo ang kulay ng tae. Baka may Paka-black na ang kulay niyan, bleeding. Instruct patient to use soft lotion to avoid injury sa gums. Limit ang solitary activity, bawal ang contact sports dahil mag-bleed. Bawal kang mag-take ng aspirin with Coumadin, guys. Maglilid yan to severe bleeding dahil may anti-platelet to, anti-coagulant to, magsi-severe bleeding ka. 99 Joe. 100! Yay! Nakatapos tayo ng NP4. Before discharge, the nurse instructed Carmina on how to prevent risk of developing pulmonary embolism in the future. Prevent daw ng pulmonary embolism in the future, which is statement of Carmina relays understanding positive. Ganyan ang gagawin ha. Pag may exam negative, pag may understanding positive. Limit fluid intake, mali ito. Maliit ang 1.5. Constrictive clothing, ayaw natin yan. Ayaw natin ng constrictive clothing, magkakos nyo ng venous stasis. I must do active and passive leg exercises. Tama to. Ito po ang tama. Ayaw po natin ng dangling ng overside of the bed dahil po pwede po itong mag-lead to venous stasis din. Venous stasis din po ito. So mali. Number 100, mag-active and mag-passive exercises ka, leg exercises to promote good circulation and therefore will prevent venous stasis and therefore will prevent pulmonary embolism. Let's go. Yay! Are we good, guys? Katapos tayo ng 150 items. So bukas sa ating 2 hours, sa ating 2 hours po bukas is we will finish 100 items ng NP5. So far, may learning po ba tayo for today's ratio? So far, may learning po ba tayo for today's ratio? Hindi ko alam kung gagaling pa to. Okay. Okay, so papasa na ba? Papasa na ba sa board exam? Ang dami nyo ng renasyo, ang dami nyo ng recalls. Papasa na ba? Papasang-pasa na. Magtatap din ba? Magtatap din ba? Magtatap. Alam niyo kung bakit ang nagrarasyo sa inyo is mga top-notcher? Dahil ito po ay tutorial. Ito po ay tutorial kung saan ang mga top-notcher ay pinapakita namin sa inyo kung paano kami nagsagot ng board exam. The way I rush to you is the exact same way kung paano ako nag-answer ng board exam. Pinapakita po namin sa inyo kung paano kami nagsagot dahil ang goal po ng top rank sa inyo is mag-top din kayo. So magta-top na yan. Magta-top na yan. Thank you guys. See you all tomorrow. Thank you po. Thank you, Sir Ron.
Thank you, ma'am. Bukas ulit.
Okay, bye-bye.